can cook turkeys in their rooms and they can, take care of themselves.
How's your family, Donnie?
Oh, thank you for asking. Good. Everybody's safe and healthy. I'm happy to report. I'm grateful for that.
Yep. There's Tori, there's Rose, Jeannie Abella, Dave Hively. Okay. There's Kara, Linda. So I saw Greg earlier, but I don't see him now.
Yeah.
There he is. Bing, bing.
Hey there.
Hey,
I'll be
Greg.
back in 1 minute.
1 minute. Okay, I'm going to hold you to that. Put him on the clock.
Yeah. Hey, Jordana, congratulations. This is Ann.
She there? Where is she?
Yeah, her name's there.
She's probably doing some texting right now.
He stepped away.
Uh-oh, there she is. Yeah, just congratulations.
Thanks, Anne.
Thanks.
Looking forward to working with everyone.
Yeah.
Well, we're so very proud of Jordana.
Oh.
I think our history goes back, gosh, when you first came and worked at Community Health Services.
Yeah.
Yep.
I was
Karen.
remembering that too. That was a while ago.
Okay. Got 1, 2, 3, 4. I don't think we have quorum yet, do we, Karen or Jordana? We're close.
You do actually.
We do have.
Well, if Tori was actually in a seat, you'd have quorum.
Well, I'm here.
Oh,
And
yeah,
second.
yeah. There you go.
He'll be back in a sec too, but in the meantime.
Yeah, and Linda's there too. So yeah, you're good.
Okay. Well, it is right at 2:30. So I do want to welcome everyone who is joining us today. I understand we're going to have quite a few people attend the meeting, and we're so honored that you're taking time out of your busy day to talk to the board, the Public Health Board. So with that, I'm going to go ahead and call the meeting to order. I'm going to see if we have established quorum. Now I'd like to review the agenda. We received a revised agenda last night, so I'll just read it to you. We will be looking towards the approval of the previous minutes. And I'll talk briefly about the working agreements of the Board of Health. Then we're going to have Josh and Dr. Levin talk about key data points. The traveler testing program overview. This is coming from a draft from Kim Levin and has been reviewed by members of the board. We'll be discussing that. And then we have dial movement update, and we have Mara. How do you say her last name, Karen?
Brosie Witcher.
Okay, she's chief of staff for CDPHE. We've had quite a few conversations with hers, and Karen and Jordana started on Sunday, and then they continue throughout the week. Karen will be talking about the update as well as John, and then we're going to be listening to the community leaders of the various business segments. So with that, do we have any changes to the agenda or any additional items? We will be open to public comment at the end of the meeting. Okay.
Do we need to move to approve the minutes? I'll move.
Yes.
So moved.
Hold on, I was going to ask for approval of the agenda first. Agenda first.
I'll
and
move to
then-
approve the agenda.
Thank you. Do I have a second?
Seconded it.
Thank you, Linda. Appreciate it. All in support, just raise your right hand. Okay, unanimous. Corrections or approval of the previous minutes. Do I have a motion for approval of the last minutes?
I'll move on that too. Greg.
Thank you, Greg. Do I have a second?
Seconded.
Thank you very much. All in support, raise your right hand. Just a few comments. As I've asked Karen to put in the Board of Health working agreements, it's very important. Every year we should be looking at our Board of Health working agreements. And this is so very relevant because we've got a lot going on at the Board of Health. And we had a little hiccup this last week, maybe not a hiccup, but we began to almost become an operational board versus a policy board. The Board of Health is a policy-driven board, not one that takes on operations. We have a wonderful department that is responsible for operations. I've asked Karen and I've asked Jordana if they need help from board members on operational issues, just reach out and we will be honored to help out in any way that we possibly can. So I'll ask if there's any questions accordingly. If not, I want to move to this very busy agenda. Okay, moving on. Karen, do you want to open with, or do you want me to just turn it over to Josh?
No, we can go ahead and turn it over to Josh and Dr. Levin. We are, as Marky said, we have a pretty packed agenda and we have a lot of people on the call that are, scheduled. So we really want to keep on task with our agenda as best we can. And so Josh and Dr. Levin are going to hit some real high points to show you where we are as a community right now and why we're feeling a little bit of I would say a little bit of stress in our community on the numbers that we're seeing. So they're going to share with you some real key points that I hope will help us to better understand where we are and where we need to go as a community in the next few weeks.
Next slide. Okay, I just wanted to start off just showing where we're at. The US reported 1,700 coronavirus deaths on Tuesday. That was the deadliest day for COVID-19 in 6 months across the country. And officials are warning it'll continue to get worse. This picture on the bottom left shows you a line of cars in Miami, and those are all people waiting to be tested for COVID. Some of them, of course, are going to be traveling. Some of them are waiting for test results because they were exposed or have symptoms of COVID. So it just shows the impact that we're seeing across the country right now in terms of just how many cases we're seeing of COVID. And then the right-hand side, that's showing you where hospitalizations currently sit out with COVID-19, which Dr. Levin will discuss a little bit more. Next slide. So this is our current data where we're at right now. So we've had 96 cases reported to us in the last 2 weeks, which is double what we saw back in July. And so that blue line is showing you the total number of cases in a 2-week period. And then the red, orange, and yellow are the thresholds for the state dial. So you'll see that we've peaked above that red in the last several days, and we're just heading straight up, and our data continues to move upward. We had 19 cases reported on the Friday the 13th. So that was 10 more than the previous high back in July. So we were just overwhelmed and swamped with 19 cases on Saturday morning to try to work through. If you press next, this will show our projections for if we continue at the current rate, that purple is where we're headed. So by mid-December, we'd have 468 cases in a 2-week period, which would just completely overwhelm the public health department. It'd be a ton of cases. Even if we cut that in half at the rate we're going, it'd be 242 cases in a 2-week period. So just a staggering number of cases that are expected, especially given the Thanksgiving holiday coming up. Next slide. This is the number of individuals we currently have isolated and quarantined. Again, you'll notice that back in July, when we thought we had a lot of cases and we're peaking and we had some scary numbers, you'll notice July is nothing close to what we're seeing right now. The blue is individuals that are currently isolated. So those are people that have COVID-19 or have significant symptoms of COVID-19. And then the red, or that pinkish color, and the yellow are individuals that have been quarantined by Pickens County Public Health due to close exposure with someone who has COVID. So the majority that we have asked to quarantine are Pickens County residents, but you'll see that we have 150 or so that are individuals that don't live here but had close contact with someone that lives in Pickens County who has COVID-19. Next slide. This, something that we hear a lot about is, hospitalizations and deaths. We've been working on a study here in Pickens County to look at the long-term effects of COVID. And so we've been interviewing people at their 6-month diagnosis date. So 6 months out from when they were first diagnosed with COVID. And what we're finding is pretty alarming. We have found that 61% of individuals that we've interviewed thus far have reported at least one new lingering or long-term effect that they did not experience prior to COVID diagnosis. So, close to 2/3 of individuals that had COVID are still experiencing some sort of effect from COVID 6 months down the line. Most commonly reported are fatigue. 21% are reporting still an inability to taste or smell, or it's significantly reduced. Insomnia is at 21%, memory loss and confusion at 18%, hair loss at 18%. Some are still experiencing shortness of breath. It's at 13%. And then 36% of those that we've talked to so far have sought medical attention due to one of these long-term effects because they were concerned about how it was impacting them. And then something to note as well is, there may be this thought that, well, these are probably people that had long or underlying conditions. 40% of those who reported one of these long-term effects did not have any pre-existing conditions. So this is affecting those with pre-existing conditions just as much or as close to as much as those who do not have pre-existing conditions. Next slide. And then lastly, I just wanted to show where our outbreaks stand currently. We had a few more that we learned about late last night and this morning. And so this is what we currently are looking at. Informal gatherings continue to be where we're seeing the most number of outbreaks and where we're seeing a significant number of cases associated with them. We're finding that those who are at informal gatherings, that the majority of them are being infected. And so there, those who are there, whether they're wearing masks or not, we're finding that there is a significant amount of spread there at these informal gatherings. And then you'll notice construction and restaurant. We've had 15% of our outbreaks each are tied to construction and restaurants. And then we have a handful that are linked to other sectors. But you'll see that really the outbreaks and the cases are affecting individuals in all sectors. So we're not just seeing it hit one sector harder than the other. We're really seeing it affect a variety of sectors and a variety of different ways in which people are interacting. So it's really just, we're seeing widespread transmission of COVID, throughout. And I think the biggest concern right now is as we move into Thanksgiving, we're going to see this impact from, expand even more. And so I think we really need to caution about having Thanksgiving get-togethers. I think it's a serious concern. And, I just think we need to be extremely cautious and careful about how we choose to interact next week during the holiday, especially given just the extent of cases we see come from informal gatherings. So I'll hand it off to Dr. Levin at this point.
Thanks, Josh. Yeah, really important message, and I echo that as well. The next slide, please. So I just wanted to briefly put up where the state looks at us in terms of our data, and just really to reinforce that state data is different from our local data, and we all know that. So I just want to look at a little bit of those differences. In the state, we've been in the red for the first one of the three variables, that cumulative incidence. It's 523, which is over 350, which puts us in the red. And we've been there for a number of days now, potentially up to 9 days. For the positivity, we're in the green, and for hospitalizations, we're in the green. And what I'd like to do is look at those two. The state has us at 3.2% positivity. And I really want to show some local data that shows that we are higher than that. And also to look at hospitalizations and how all this data really doesn't give you the complex full picture that we do have here. Seeing that we don't have any hospitalizations currently at ABH, but really that is not the most important part of the data. And there's a deeper look at it that I wanted to just quickly go into. So next slide. So looking at positivity, this is ABH data testing only. So this includes visitors, whereas the state does not include visitors. And I think it's really important. So right now we're basically at 10%. We're at 9.76%. On August 23rd, we're at 1.15%. So we have climbed dramatically and consistently since then. And we're at basically 10%, which in the state would put us almost in the orange for positivity rate. And then you can look and see all of the increased testing that we've been doing at ABH. Next slide, please. In terms of hospitalization, this is the state hospitalization data. So this is a dramatic picture of who is hospitalized now throughout Colorado. We have gone well above the height in April, and we're basically at about 1,600 hospitalizations today. We were at 211 hospitalizations on September 3rd. That is such a dramatic increase. And these are the people, typically hospitalizations lag a little bit from increase in incidence, but these are the sicker patients, and the graph is not changing. We're on an exponential curve here. As well, CDPHE also collects information on staff shortages, and about a third hospitals anticipate staff shortages. At ABH, we have 15 people out total. There's actually 12 who are in quarantine, and we're finding that's a huge part of keeping a hospital going, are people that are going to be out for both quarantine and symptoms. Next slide, please. And this, I think, is really important as well, is critical care ventilators in use. So the state has a total of about 1,123 ventilators. Right now, about 50% are in use. On September 15th, the middle of September, there were a quarter in use. So it has basically doubled the amount of ventilators that we're using statewide. Again, these are the sickest COVID patients since the middle of September. Why I'm telling you all this is that we are part of an integrated system. So if you go to the next slide, when you look at AVH data, it doesn't reflect exactly what's going on. It's really important to look at us as an integrated system. We are referring and transferring patients to higher levels of care who need ICU beds and need ventilators. And if you look at the Northwest, the 25% available ICU beds right now, that's where St. Mary's Hospital is. And St. Mary's has been chosen by ABH to be our referral hospital for COVID patients. So every rural hospital had to choose a hospital to refer COVID patients to. St. Mary's Hospital right now has 32 COVID patients in-house. There are 6 that are vented on a ventilator. There's only 3 open ICU beds at St. Mary's. And if you look at the Front Range, there's only 13% available ICU beds. So really looking at AVH as an integrated system, we are not in a bubble. If we fill up, or if we even start to fill up, it is then too late to start making changes. So really the same message is to start making changes now. It's critical what we do in the next 3 weeks. And if you show the next slide, this is my last slide, and this is the number of deaths. Again, they always lag incidence, but the deaths are rising, and this is some of the most alarming data. Again, I also echo what Josh mentioned, that it's not just deaths, that the huge impact of COVID is on long-term effects. This is all, they're both alarming data. So the message again is that we're not in a bubble. We need to act now. We all need to be as safe as possible and make the best decisions over at least the next 3 weeks. And this is going to be ongoing. It's not just going to be a 3-week stint, which I wish it all were. It's just really changing our behaviors, but tightening down now. And I think that's it for me. Thank you.
Okay, Marky, it's Kurt. Do you want me to go ahead and jump into the travel testing program?
I think you're not unmuted, Marky, if you're talking.
Well, there you go. You think I'd learn how to do this by now. But it's very important, the news that both Kim and Josh shared with us. I had hoped that by now we might see some better news, but it's not looking that way. We're trending the wrong direction. But I'll see if the board members might have any questions for Josh and or Kim. I don't see any hands going up.
Are we including the
Tom?
positive?
Dr. Kurt.
Are the positive cases that are coming in from the school or from the Clark's Pharmacy being included?
Yes, that data has been included.
Marky, I have a question.
Yeah, no, Gray's got his hand up as well, but go ahead, Patty.
Yeah, real quick, on the graph that shows where the cases are coming from, say grocery or construction, I didn't see anything that, we're looking at also retail and lodging. Is there no information about positives coming from any of those sectors?
Yeah, Patty, there are currently no outbreaks associated with those sectors. So it doesn't mean there's not any cases associated, but we haven't linked any outbreaks to those sectors at this point.
Okay, thank you.
Greg?
I had the same question as Patty. Thanks.
Okay. Anyone else? Kurt?
Okay, thank you, Marky. So I was asked to talk a little bit about traveler testing program. Last Board of Health meeting, there was some conversation around this and some interest in looking at what a program might look like. So the team and Josh and I went out and reviewed a few of the programs that are out there in the country and brought back some information and a concept in terms of what a travel pre-testing program might look like. Next slide. So based on what we found and based on what we thought made the most sense from our point of view, the traveler testing program really would look like somebody who has a desire to travel to Pitkin County would take a COVID test prior to their departure here, 72 hours prior to departure. Once the test has been taken and they get their results, they upload that information into a questionnaire. That questionnaire would be completed by the traveler before they travel here. Then we would end up with an automated system that verifies the information and sends a QR code to the traveler, excuse me. So at that point, the traveler would then depart for Pitkin County. When they would get here, the QR code would be scanned to ensure that they have one. If it wasn't scanned, then we would have a separate place where somebody could either go to get a QR code if they had a test and just didn't have a QR code, or link them to testing resources in the county so that they could get a test and they would have to quarantine while they were waiting for the results on the test. The other thing about a QR code would be then there are other sectors that could utilize this information as well. We're giving an example of an airline industry. The example of Maine, the lodging industry there requires a test result, a negative test result in order for reservations. So you could again utilize this QR code as something for lodging industry or other sectors within the area as well. So once they've gotten through their initial scan, once they've been here though, the idea would be that they're free to go ahead and travel through the region, enjoy their vacation, go skiing, do what they need to do. Next slide, please. So this is really what we want to talk about here more than anything else is why. Why is this something that we think travelers need to be looked at and certainly provide a negative test before they come? If you look at the case numbers through the year, December is projected, and obviously we have a capacity with our contact tracing team, which is that box it in strategy. And we're already concerned and we're already going to be talking about other mitigation strategies later in this meeting. But obviously the travelers that we're looking at is going to increase that capacity and could push us over the top of what our abilities are. So I think that's a concern and part of the reason why we're interested in at least looking at this sector as well. Next slide. So this is data from Hawaii. When they have a program that's a QR code program as well that is required of travelers, very similar to what we've proposed. You can see initially where their results are. The graph is showing their case numbers. Then they implemented a 14-day quarantine, right? And obviously that did very well. It's not something that we think is reasonable here. I know that idea has been floated around, but you basically are saying you're going to show up for 14 days and you can't do anything in your hotel room or your house before you can go out. That just doesn't seem reasonable. And one of the reasons why we thought a pre-test was the best way to go. Then once they've enacted it, You can see that the cases increase a little bit, but they haven't jumped back to the same levels that they had previously. So that would be expected. This is a program, and especially here, a little different than Hawaii. If this is a program that's implemented, it's another line in the net. It's not going to capture everyone, but it's intended to capture at least the majority of the people that might be coming in to ensure that they're not ill and that they're not spreading the illness once they get here. So, and again, the volume that you're looking at once the Hawaii has implemented this program, you're looking at an increase. Their air traffic and quadrupled over that time period, and yet you see the smaller increase. So, you know, again, it appears like the system's working. Is it capturing everybody? No, but it looks like it's working. So, so conceptually, those are the reasons why we think that this might be a program to adopt. Can you go to the next slide, please? But I think the important thing is, you know, this isn't something that we're just going to be able to do as public health on our own. If this is a program that's desired, it's really going to have to be a community effort. So really at this point, I think there's a question around, we need to have stakeholder buy-in and participation, not just buy-in and agreement, but I think there's a question around resources and what those resources look like. This is something that we would require people to be checking either QR codes or potentially checking, you know, if people are properly filling out forms and just customer service. And then obviously there's an increase in testing that we would have to address as well. The QR system itself, we've had some initial talks with our IT department about that. They believe it's something that can be done fairly easily. There are some questions around exactly what data we want to capture and how we capture that to make sure we're HIPAA compliant. So that would still need to be done. Again, identifying the staffing that we would need to have in order to make this run. This is something that's going to be outside of our existing resources. So we're going to have to identify some new resources to do this. And then communication to the stakeholders and travelers. This is a really important piece that not only are people going to have to be notified if this is something that we adopt, we're going to have to be able to give them time to do it. Obviously, the timing of this, we're thinking about wanting to have this in place before our Christmas season is here, because we know that that's a peak for our travelers, and then again in March. So we'd like to get this in place as soon as we can. And I think some of this will be working with airports and airlines to see what options we have for notification when somebody, say, books a ticket. We're also conceptually thinking that not only do we need to do this on the commercial side, but the general aviation side as well, knowing that we get a fair amount of passengers that come in both. And then the other piece that we're working on already, but we need to make sure is in place, is for those people who don't get a test before they come for whatever reason, we're going to need to make sure we have the capacity in place to then address those testing requirements, that once they get here, they'll need to test and they'll need to quarantine, but we want to make sure we have those in place before we start the program, so that we're not giving people significant delays once they are here. So I think it's a short, sweet. I know we had a lot on the agenda. I hit you with a lot of information. Josh, is there anything you'd like to add?
Yeah, if we can just go back 2 slides real quick. Just want to emphasize, again, the importance of this and why we're proposing it and why we're thinking it's important for us to spend some time considering this. The black line in the middle there, that's what we anticipate our contact tracing capacity to be. So we feel like up to this point, we've been lucky to have enough capacity to be able to reach out to every single person that tests positive and all their contacts. Our concern is that moving into December, following the Thanksgiving holiday, and then moving further into the winter, we'll reach a limit. And we will not be able to call all of those who are testing positive, especially those who are out-of-state travelers. So, we might have the capacity perhaps to contact all of those who are Pickens County residents, but we may not have the capacity at all to reach out to those who are traveling here. So that means that people might have COVID in our community and they're not going to have a phone call. We might send it off to their home jurisdiction to have them call them, but everyone is swamped, right? Everyone is busy across the nation, and will not have the ability to reach out to these individuals, especially if they know they're traveling. They're just not going to call them. And so our concern there is it's going to lead to increased growth and transmission of cases. And so these numbers that we put up here, this is the range of what we're expecting. We're thinking that we'll probably get about 55 at a minimum individuals that are traveling here with COVID, but that could go up to 517 at a maximum. And that's just travelers. And that's not including the rest of the cases that we're expecting to see. So we're very concerned that, you know, our contact tracing can be overwhelmed. And so we're really looking for some sort of program or way in which we can try to reduce our cases so that we can really continue to make sure that we're contacting everyone and reducing transmission as much as possible on the back end from a contact tracing perspective. But we're concerned looking at these projections to see how many cases we might anticipate, not just from our own residents, but from those who are traveling here. That's all I would add, Kurt.
Thanks,
Mark, you
Josh.
have a question?
Yeah, go ahead, Patty.
Yeah, how does this affect locals? So say I travel to, you know, Southern California. Do I then have to be tested 72 hours before I can come back and go home?
You know, Patty, that's a good question that we haven't answered yet. Karen brought that up as well. When we talked about this originally, we were thinking about, as a traveler, it would be somebody who is not a full-time resident outside of Pitt and Eagle or Garfield counties. But I think that's a piece that we haven't considered that we need to is if you live here and you travel somewhere else, do you need to test before you come back? And my inclination is yes, but it wasn't something we had a chance to debate with the team to see where they wanted to land with that.
Greg?
Yeah, thanks, Kurt, and everyone who's put this together so quickly. Thank you. It's great to see this. I know there are a lot of big questions out there. The ones that I'm getting from people who are texting and phoning in are, what about people who drive in, of course? What about people from our bedroom communities, to call them that, not to be derogatory or anything, but commuters who go to Garfield and Eagle and other points. If those counties don't have the same sort of island-like attitude of Hawaii that we'd like to have, how do you think this would still work? Will this still be effective?
So the first question, you know, we intended to, if you're a resident of Garfield or Eagle County, as well as Pitkin, in your day-to-day travels, you would not be required to do this. So it would just be the people who are spending the night from outside of those jurisdictions that we would expect this to address. Is it going to capture everybody? No, it's not. In fact, you know, we know that there will be travelers coming in by car. This system at this point, what we're thinking of is the airport. However, the cool thing about the QR code is that we could implement this system in other places as well, which is why I mentioned Maine. Maine requires the lodging in Maine requires people to have a pre-test and a 72-hour negative result. So we could expand this out to try to capture more. I mean, I'm going to, with a straight face, tell you, will it capture everybody again? No, but you know, it is one more layer. So there's the possibility of that. I think for simplicity, this is where we've started. And obviously there's partners that we need to engage in all of this. And I just don't know the appetite for whether or not the lodging industry would be interested in that. We don't know if the airport would be interested. And that's kind of the next step in this, is starting to reach out to see who might be able to partner with us to work on that.
Kurt, I had a question come in on my iPhone as well. Would we be setting up, or would we contract with someone at the airport to do testing at the airport, or send them over to another testing site?
Yeah, so I know we're in talks about different testing sites, and that may be one. I don't know that you know, again, those are concepts that we're talking about. But even if we didn't, we would provide a list of the different testing resources, and there are a number of them that are opening up and will be opening up in the next couple of weeks, that we would provide that information to those folks so that they knew where they could get a test.
Thank you. Other questions?
I have a question. It's Brent.
Yeah, go for it, Brent.
Yeah, okay. Yeah, I just wanted to say first, to me, this whole thing is messy, and I don't think anything that we do or is done by others is not going to be a little messy, and there's always going to be things that slip through the cracks. But to me, the airport is just, and this is kind of, you know, obvious to everybody perhaps, but it's a natural control point, especially for our valley. And the fact that we can use this technology other places is just, to me, a huge benefit. And it seems overwhelmingly true that the data you present says this is something we really need to seriously go after. And there's going to be a million questions and stuff that has to get answered. But I think this is just a natural and a terrific idea, and can't happen soon enough. And hopefully there's other models out there that we can investigate or others can investigate. But I think, we do what we can do when we can do it. And this is something that, is right here in front of us. And then the other analogy, get off. And that is, like it or not, we're sort of a cruise ship. But the problem is, unlike a cruise ship, that if somebody gets infected, they can isolate the cruise ship and they don't get to land until they've figured it out. Our cruise ship comes into port via the airport every 7, 8, 10 days when people come and go. And so it's a huge thing that could easily get out of control. So I think our future demands that we do something, in my view, something like this. Thank you.
How about other people? Tom?
I agree with Brent. He has airline experience, and I recently was on vacation myself where a test was required 5 days within your date of travel, and you needed to register that with American Airlines. So the airlines could be a facilitator of this, as well as something at the airport.
Kurt, do we have any idea how many states have adopted such a program?
I believe it's 20, Marky, maybe 22.
Thank you,
Okay.
Josh.
And this works for everybody. This is a great sales.
I think the challenge here again is the resources that are needed. I mean, as Marky said, how many states have done this? Josh, I don't recall that we saw if any locals had done this, and I think that's the important piece to get across here is, again, I think this is worth pursuing, or we think it is, but we're going to need help. We're not going to be able to do this on our own.
Yeah, Patty?
Yeah, Kurt, thank you. I want to tag on to the resources. I know this is something, especially Greg has been talking about for a while, and I think it's something we need to look into. But when you talk about resources, people are coming to the Aspen-Pitkin County Airport. They're coming in the winter to the municipalities. Pitkin County, of course, is part of that. But we're going to, I'm speaking for the Board of County Commissioners, we are going to need help with resources all the way around, financial, staffing, et cetera, if we want to implement this kind of program. We're going to need to have everybody involved, including some of the industries, lodging, municipalities, really step up to the plate here if we're going to pull this off. And I definitely think it's something we need to look into. Having seen it work in other states, I see no reason why it can't work in our local airport.
Okay, other comments?
Question.
I do know. Go ahead.
Marky. Yeah, thank you.
I might also just.
What, Brent? We'll let you finish. You froze. Tori, go ahead.
Okay,
I was just
while
gonna
he's
say
frozen.
that,
My question is, how does this layer in with our efforts on the state level? Right, we've been talking about this for a while and about lobbying for the state to institute something like this. How does that layer in? I see the letter that we're talking about sending also is still advocating for this on a state level. So how would these run concurrently or merge if they do happen?
I'm going to ask Jordana or Karen to give us some feedback on that because it was discussed with the
Marky,
state.
this is Dr. Levin. I have another slide. The next slide is actually addressing that. One more. Yeah, thanks. I'll just mention this quickly. So thanks, Tori. So I've drafted a letter, and I also want to thank individuals who have helped to edit it. So the first step really is to advocate to the state and try to get it done on a state level. And so we have this letter. It should have been part of the Board of Health packet today. I think the letter is fairly finalized, and I just wanted to put down the main points of the outline of our mitigation measures that are in this letter. And what we want from this letter is really broad stakeholder community support. So Board of Health support, public health support, but also signatures from main leaders and stakeholders in the community, so that we advocate at a state level to have this done at a state level, which is really a lot more support for the county in terms of enacting something like this. And so this letter is ready to go. It just needs to be signed. These are the main points. They were basically outlined by Kurt and Josh, including what we currently have in our public health order, which is symptom-free for 10 days prior to travel, negative test within 72 hours, this mandatory health declaration form, that you quarantine if you show up without a test, that you have an option to purchase a test and you quarantine until the results are back, that there's screening, communication, and I won't go through all of it, but basically this is the same points, and that the visitors are really responsible for all the costs that are accrued should there be a 10-day isolation period if they have a positive test when they arrive, and if they are within any type of public health contact tracing, that they also have a 14-day quarantine period, and that they need to work with local public health. And I think a lot of this does depend on having enough, I mean, everything that we've mentioned, there's resources to put together, it'd be a huge program. I personally am a strong supporter of this happening at in our county. I hope that the state would adopt it and support the counties. But again, if they don't, I support moving forward with it on a county level as well. I do think that what Brent said, that this may not be perfect. We do our best to put this together the best way we can, and we will then capture a percentage of people, and that will be a win. We're not going to capture everybody. And Hawaii kind of talks about it in the same way, and looking at their data really gives us more emphasis on the importance of doing this, just because we intrinsically are a tourist community, and therefore a program like this is going to have a large impact here, even if it's not perfect. The next slide is just I know probably most people have seen the Swiss cheese model. I just thought I'd mention it in this context, that this is another layer, and it's an important another layer. And there's not one solution to the entire pandemic. And so you have wearing a mask, social distancing, testing, vaccine, and now hopefully this as another layer. And so that's the importance and the argument for really the nature of our community. And I think it sounds like it could be a daunting task, and hopefully it wouldn't be as difficult to enact as it may seem at this point. But I'm certainly a strong supporter.
We did talk with the state on Monday morning, Karen, myself, and Jordana, about a travel requirement program. And John Peacock also attended that meeting. We will be talking with Mara a little bit later at 3:30, whom we met with by Zoom. We are aware that it's been discussed at the state level, but it doesn't appear that we have a lot of support from the state to enact this for the entire state. So as far as I'm concerned, I think it's a great idea that Pickens County take the lead.
Markey?
Yeah.
As to the letter, as soon as we get a finalized draft or finalized letter, please make sure I get it as quickly as possible so I can send it on to Northwest Colorado Council of Governments. We can disseminate it through all the member jurisdictions. I've held off waiting for this final letter to come out, so I'd be more than happy to carry on and carry that through for the group here.
That'd be wonderful, Patty. And I'm sure Tori would do the same thing with CAST.
Perfect.
Okay. Kim, did you have another comment?
I had something. Okay.
No, I just wanted to say thank you, Patty. And I think this letter, once it's approved, hopefully today, that we can also have stakeholders in our community sign it as soon as possible, in addition to everyone else. And so you'll be look out for an email for whoever's hearing this and wants to sign onto it. Thank you.
Yeah, we have 287 people participating in our meeting. And we have briefly talked about the letter with the business community. It'd be wonderful to have individuals representing various aspects of the travel and our business community also be very supportive as well.
Can I just say one thing, and that is this: if we decide that this is worthwhile, for me, to say we have a funding issue in Aspen sounds crazy, because if we need to get this done, we can't get state funds or federal funds, perhaps we can borrow on on some sort of basis from the state. And even if we can't do that, perhaps even, I know this sounds crazy, but a GoFundMe page. We have hugely philanthropic people in this city. And this is an emergency of all emergencies in their lifetime. And if there's ever a chance or an opportunity to spend money intelligently and arguably save lives in the bargain, this would be the time. So I think that's another avenue that we could look at. And certainly the stakeholders and the hotel owners and the restaurant owners perhaps can reach out, and who knows, some sort of civic program like this.
Just thinking about it, we know we want to get this entire community fully open at Christmas time. We don't want our businesses to continue to struggle. And if we could do something like this, I think it would be an asset for the business community. So we can get our restaurants open, the mountain is not suffering, et cetera. So I'm very supportive of moving forward. How about someone else?
Mark, it's Ann.
Ann, go ahead, Ann.
Yeah. Do you know, when you talk to the state, do you know if we had something like this in place, if the state would let us be less restrictive than whatever orange, yellow, red that we're in?
Well, I'm going to let Karen or Jordana or John Peacock answer that question.
I'll answer that. So, and we've talked to the state when we were asked to put together a mitigation plan. Testing is a form of mitigation. So it can, it's something that they're looking for as far as what are we doing locally that is not necessarily policy, but it's operations, right? Or a tactic. And so they do look at this as mitigation. Now, does this allow us to not be in a certain color because we're doing more advanced testing, unless it's driving down those numbers, because those 3 numbers that we've all been looking at are the numbers that move us in the dial. So I think it helps to maybe extend that timeline around mitigation. If we can drive down our numbers with these kinds of strategies, absolutely. But I don't think it's going to be the bullet that's going to allow us to stay in a certain color or not.
Right. And this certainly would be something that would bring the numbers down. Correct. Yeah. Okay, great.
We would hope.
Kim, did you have your hand up?
I just had one last comment about the IT side of enacting something like this. And if there is creative solutions in terms of these bright IT minds who are in our community that would be able to work together with the county and create a team that could put this together faster and make it a way more efficient process in all sectors. Just as a shout out to the community that might be something to creatively try to work and put together.
Good idea. Other questions? I'm looking at the chat room to see if there's anything there. No, there's nothing in the chat. Okay. Could I have a motion from a member of the board? Oops. Oh, Mike Kaplan wants to ask a question. Go for it, Mike.
Thank you. Sorry to jump in, but just want to say that, well, I'm a ski guy and not a health guy. I look at this and I just want to urge caution. When I look at those charts and the deficit, I see the deficit being in contact tracing and symptomatic testing. And I think if you're going to do this, you got to make sure it cannot come at the expense of that. And I think when I hear Kurt, and I've talked to others about this, when they talk about the resource constraints, it's the time, it's the IT, it's the money, it's the space in the airport, it's the testing sites, it's all those things. And I think by doing this, you're putting a lot of time, energy, and resources into the 35% at the expense of the 65% of the problem. So as a business person, I'd encourage you to fish where the fish are. Make sure you've got those aspects of your layered mitigation covered, and be really thoughtful also about what analogies you're looking at. Hawaii's an island, it's a state. They totally shut down their economy for 8 months. They got their spread to 0. And I look at that chart and I see it rising up quite sharply, and quite sharply relative to the number of visitors they have there now compared to where they were. So I urge those cautions. Look, I want to get open. I want to stay open. I want to do it safely. I support testing and all the above strategy. But I urge you to look hard and realistically about your resources and your ability to execute and leverage those resources where they're most effective.
And I would just also add, Marky, it may be good to think about the whole picture, because we're going to be talking through a lot of different mitigations, and we're going to be hearing from industry, and that may affect how we talk about implementation of these, because there's a lot of I think options for us to potentially even simplify on some of the visitor requirements. So before we, I just want to be cautious before the board takes a vote. The dollars would still need to be approved by the Board of County Commissioners. And you may want to integrate the whole system because there would have to be expectations of the lodging community and other players. And you may want to hear from them also.
That sounds like a wise move. Thank you very much, John. And thank you, Mike, for your comments.
And Marky, this is Kurt. Can I add one other comment?
Sure.
I think what Josh and I have here is a concept, and I think there are a lot of details that we still have to iron out of this. There are a lot of partners that we're going to need to engage that we just haven't had a chance to in the couple of days. And I think it's really important to realize that those things, we're going to need to come back with a lot more detail on what that is, but this is just a concept we're trying to get started with. All right.
It'll be interesting to listen to the various members of the business community after as we go through the agenda. I do also sense, I think there's consensus from the board that this may be very worthwhile pursuing, even though we know we've got a long way to go. So I'll be looking forward to members of the business community here shortly.
Marky?
Yeah. Yeah, Patty.
Yeah, real quick, I'm not a voting member of this board. I'm only an alternate, but I might want to recommend that the board just give direction to staff to further pursue this and bring it back at our next meeting. We can always call a special meeting next week if we choose to, because I know this is something of urgency, before actually voting to pass something that has so much more information that needs to be garnered before we actually know what we're passing at this point.
What we'll do is come back and visit this towards the end of the meeting, as well as where we're going to be on the dial. However, there is a letter that has been drafted. Where is the board on supporting that letter, perhaps going to the state that Kim outlined just briefly? Any comments?
I'd like to comment that this be a subject of study so that the best possible plan for our community gets adopted, and that we don't necessarily drop this because it comprises only 35% at this time, but rather our population now does not have the doubling that tends to occur during Christmas, New Year's, and so the 35% might jump to 50% or more at that time.
Thank you very much, Tom. Good point. Anybody else? Okay, we're going to loop back around on the issue of the travel requirements towards the end of the meeting after we listen to others, stakeholders. And how about the letter? What are the thoughts of those of you who are on the board relative to the letter?
Mark, I have a question just in regard to the RT-PCR test within 72 hours before arrival. Generally, I mean, here, if somebody goes to get a test, it's going to take at least 3 days to get the results back. So we're saying that we want them tested, say, 6 days in advance before they arrive, essentially, right?
Just 72 hours, 3 days in advance that they would get those. But they
That's a
would have the
negative
results.
result.
Yeah.
A negative result 3 days before. Is that what you're saying? Is that?
But they would have to get their test, they'd have to be tested, and then they'd have to get their test back, and then they'd still have 72 hours advance. So the window is relatively large before they would travel.
So Bill, or this is Kurt, are you talking about concerns around turnaround time from when you actually take the test to when you get your results? Is that what you're asking?
Right. I mean, if symptoms are, up to 10 days, I mean, we're opening a pretty big window there, and I'm not suggesting that we tighten it up. I'm just saying if we do require those tests, it's a pretty big window for them to fly through in order to get, meet this requirement.
Yeah, Bill, I completely understand what you're saying. And it may be that it's 5 days before travel or getting a test and it takes 3 days to come back. And some people might be able to get tests with a quicker turnaround time, but it would be as close as possible. And it's possible some people arrive and their test comes back that night. And so then they quarantine until the test comes back. But you're right, there could be potentially a bigger window period because they need their result within 72 hours.
Yeah, I mean, I just think the biggest hurdle that we're going to run into is messaging. Again, if we're going to be different from other counties, we got to be very clear, and I think we need a really strong system to push these messages out there so people are really clear as to what the expectation is.
Good point. Very good point.
And I think, Bill, along those lines around messaging, what we know is that test tells you in that moment that you took the test, you weren't testing positive for the virus if it comes back negative, but it doesn't mean in that interceding time that you've been exposed, or, once you come to Pickens County, you could be exposed. So I think just really, to your point, that messaging of just because you have a negative test result means you still need to take all of the precautions that are in place when you do arrive.
Well, something's better than nothing.
Yeah.
From my recent experience with American Airlines, you could not initiate your flight unless you had a QR of your test available to put into the airline system.
Yeah, and our understanding, Tom, is that SkyWest is not set up with the same capability right now. We have been working with the airlines. There may be, another option as we get to the end of this. I think, for example, Massachusetts simplified this with a requirement that people traveling fill out an affidavit that they've had a negative test within, in Massachusetts, it is the 72 hours prior to arrival. No uploading of the test results or that sort of thing, but a requirement that the test results be available upon request, or you're in violation. And that's something that's probably a lot quicker for us to be able to set up that kind of affidavit system and maybe even do some spot checking if there's a desire for further enforcement. That would probably require some staff to track that down. But those are probably quicker ways for us to do this, because I think we are going to have a real challenge with the communications piece. With Pickens County going out on its own, I think we can expect that a number of people will not be aware of that requirement without full participation from all our business community and making sure guests are aware of that before they come. But that's an easier way, I think, for us to act quickly on a testing requirement, but it's not quite as it's not as tight a net. The tight net's going to take us longer and more resources to put together.
That sounds like a pretty good option as well. It's one more layer that we might want to look at, John. So thank you. And I do see that Debbie Braun wants to speak. So go ahead, Debbie.
Thanks, Marky. Thanks, everybody. I actually just came back in from Alaska, and you have to test when you go to Alaska. You take a test 72 hours. If you get there and you don't have the results, you just quarantine at an address until they come in, and then you just upload them to the site. Really, the testing requirements seem very easy and not as difficult as maybe we think they are. But regarding testing requirements, I thought it's important to note some data. Fewer than 50% of our winter guests fly into the Aspen airport. So that's not going to do anything to our guests who fly into Eagle, Grand Junction, or Denver, and then they rent a car and they drive. So we think it's going to capture potentially less than that 50% of your inbound travelers. It just might feel like a layer of Swiss cheese of protection with 60% holes and 40% cheese. Once the word gets out that you need to fly to Aspen, but you don't have to get the testing requirement for Eagle or Grand Junction, what's going to happen? These are more questions than just answers. And then I think to just be really effective, we might need a checkpoint, both at like the airport and on the highway, because people are coming in a lot of different ways. It's not just through flying. I only offer that as just food for thought, and I will mute. Thank you.
Thank you very much. It is 3:30, and I know we're going to be joined by Mara from CDPHE. Karen or Jordana, has she linked on?
I'm looking.
Hey, Marky, I'm just concerned. I don't know if you were asking for a vote on the letter yet or not, but I was hoping that we would get some other business community to weigh in just to talk about the intricacies of making this work. Debbie made some great points. Our winter economy is at stake, in my opinion, so I think it's important that we get the business people.
Yeah, what I'd like to do is loop back into this conversation as we listen to the business community and other stakeholders. Okay, I'm looking at Karen.
Well, I'll just go ahead and get started, and hopefully Mara will be joining us. Mara, I'll do a shout out to see if you're there yet. I didn't see you on the panel yet. Okay. So Lindsay, can you go ahead and pull up the dial slides? Thank you. Okay, next slide. So I know that we're in a precarious space in our, what we're seeing, as we saw with both what Kim, Dr. Levin, and Josh shared right now. It is really hard to hear. We just heard that Colorado will be exceeding 6,000 cases today. That's a pretty impactful number. And as we move forward, and that we're really trying to, in essence, save lives, save our schools, save our season. You know, they don't have to be competing interests. They can be actually aligned interests that we're all working forward collectively together to make this happen. And it just made me think about, you know, how we can extend care out for others and have compassion in this really difficult time for everyone. It's certainly difficult, I think, for sectors to be thinking about, you know, orange and a potential even, you know, more protective measures being done in our community and the impacts to their businesses and their employees. It's certainly hard to think about the hospitalizations and people. You know, we just learned of a good colleague who lost a mother just yesterday to COVID-19, and it's hard to hear those stories as well. And so I just would again extend, you know, this plea and understanding that we're all in a really difficult spot, and we understand and have empathy toward where everyone else is coming from, because we're all in this, you know, in a way to make this as healthy and best for our community. We all care about the people of our community and their health and their safety. So next slide. So this is just another, you know, it's not anything different than what you saw with what Kim showed, but it just shows again that we have been at that old red for 4 days, probably now 5 days, that our numbers show that we are in red. We are talking about, where we are in schematics on the dial with the state, but ultimately our numbers are showing that we are in the old red, which was a stay-at-home, and we're actually in the new red as well, which isn't a stay-at-home. The purple is the stay-at-home. The purple on the dial, as we'll get to, really means that the hospital system is breached and it's not able to do the things that it needs to do to not only protect people who have COVID-19, but to be able to provide services for folks that are coming into the community or sorry, coming into the hospital with other ailments. Okay, next slide. So this is just, again, an incidence rate where you can see, the changing tide of our whole state, and really looking at how the state is shifting to that red level, and that it's ubiquitous. It's really changing very quickly. Next slide. So this was as of yesterday. You can see very few communities in the green, a few communities scattered in the orange, most are in red now. Next slide. So as you're all aware, that the state changed the dial system as of noticing us on Monday that they were going to be potentially changing this. On Tuesday, did a public announcement with the governor's office, and now looking at communities moving into these new dial ranges on Friday. But with the new, like I said, the new purple is that breaching of the hospital system. I'm going to pause and just see, Mara, have you been able to join us since I started? Okay, all right, let's just keep going. So what this means for all of us, just to have context, is that we have been put into the orange level, which was different than we were last week. When we look at what the new red looks like, it really is a severe risk. And again, our numbers are showing that we are in that range right now with our incidence rate. And I just want to walk you through a couple of these things. So in orange, when we look at high-risk populations, you can see that we really want to encourage people that are most at risk for getting COVID-19 to do remote work, to not have to, interface with other folks so that they can stay healthy. It's not really different between orange and red. When we look at variances, we didn't have any variances in Pickens County, so that's not really relevant to us. Personal gathering size, we had already reduced that with our own public health orders, so it's actually still at 5 from no more than 2 households. You can see in the red level, and this is what the governor has been messaging recently, that really he's saying, you should only be with your household at this point, and really not having any group informal kind of personal groups gathering. Childcare remains open throughout all the levels. P through 12 schools in orange, giving the option of in-person, suggested, hybrid, or remote as possible. You can see that in the red, P5 is still in person, suggested, but they can go hybrid or remote as appropriate. Middle is in person and hybrid, or remote suggested. In high school is actually just hybrid or remote suggested. Higher ed, there is a change from in-person hybrid to remote, and that level red. Next slide. Places of worship at this point, they're at 25% capacity or no more than 50 people with the calculator, the space calculator. That would be the same in the level red. That's for life rights. And then for other, that's indoors unseated, and then indoor seated functions, you can see that it's the same for both colors as well. For life rights outdoors, it is the same for both colors. Restaurants, this is, I think, the tricky one. So at orange, 25% capacity with 50 people. And then in red, we know that that would require indoor dining to be closed with just takeout, curbside delivery to go, but there would still be outdoor dining. And then you can see that in the restaurant outdoors, the open air with only groups of own household is open in red, but in orange, allowing parties to kind of mix together, household parties too. Last call in orange is 10. In level red, it is 8. Manufacturing, not super relevant for our community, but it remains the same. Next one. Offices, 25% capacity. At level red, it's 10% with remote work strongly encouraged. Gyms really drop down between 25% capacity at orange and 10% capacity in red. Group sizes for sports and camps really are the same. For critical and non-critical retail, they actually changed this, and they're both the same for 50% for both those pieces in orange and red. Personal services like getting your haircut still at 25% for both. Healthcare settings, limited healthcare settings, 25%. Next slide. And then we're finally looking at events. So indoor events unseated, 25% in orange. Level red, they be closed. Indoor seating events and entertainment, 25% in orange, closed in red. Outdoor events, 25%. I'm just not talking through all the person capacities, but you can see those would be about the same for both. Outdoor seated events and entertainment, looking at about for those, but they're, again, in red, they're really limiting who's mixing together. And then finally, for outdoor guided services, they're the same for both colors. Next slide. Okay, so this is just kind of a general synopsis of those. I won't go through those details. It's just a different way of looking at it and a different visual. Next slide. So I just want to tee this up a little bit because I know that the conversation is that we're in orange. As the community, can we all come together and really think about collectively other ways that we can mitigate and create more protective measures in our community to really drive down numbers so that we can save our winter season? And this is really the crux of the conversation today. We're going to hear from a lot of different sectors. We're going to hear from folks that have some ideas around what they can do in their own sector to add additional layers of mitigation and protective measures to the orange level. I feel obligated as public health to speak for my sector as well. So this is our mission, to work with community to promote health and prevent disease by protecting and enhancing environments, policies, and systems that support positive outcomes for everyone. That's what we've committed ourselves to do. And we are really extremely committed to that work. And next slide. What we know is that part of that is engaging our community and hearing what they what they feel like are good mitigation strategies, what works well for their sectors, what works well for them feeling in charge and in control of how they can help our community thrive in this really trying time. And so we really want to hear from the community. We've been engaging the community to hear what their strategies are, and we're excited to hear what they have to put forth to layer on the Swiss cheese model, as Kim brought up. What are the additional measures that can be layered on so that, again, we can save lives and save our season. So I look to this whole community to come together and to think about what's your part. What is your part? Whether you're a person or a business or a public health official or a healthcare worker, what is everyone's role to make this work? So that's what I would ask of all of you to be thinking about. And as we move into the next section, we're going to turn it to community leaders to share with you some of their thoughts. And Mara, I'm going to see if you're on the call yet. Okay. So next slide. All right, Kara, I'm going to turn it over to you to introduce this section. If you're there.
Hi, everyone. And so I just shared these, Debbie, to you and Jennifer, because I realized I probably forgot to share the slides to both of you. So apologies. Hi, everyone. Yeah, so Kara Silbernagel with Pitkin County, and I just want to do a brief introduction and then hand it over to Jennifer Albright, Rose Avello, and Mike Kaplan. This has been a really fast moving week, as Karen shared. We got a lot of different information between Friday and Monday, and did some amazing business sector outreach with our partners that would not have been possible without any of the partners listed here: ACRA, Snowmass Tourism, Aspen Seed Company, City of Aspen, Town of Snowmass Village. We were, with some public health staff, able to really have some really helpful, fruitful conversations with our community members. And so first and foremost, just want to give a shout out to all of them to really helping step up, helping organize and facilitate some of these meetings. So just a brief overview of what the outreach looked like between, I guess, Monday and today. There was 4 different business sector meetings with over 180 participants. There was a lodging community meeting, a restaurant meeting, an events and arts and culture meeting, and then I know that there's been some additional outreach via email to gym and recreation centers, as well as the construction industry. And so with that, I'm really going to turn it over to, I don't know if Jennifer or Debbie, you want to take these next slides and let you all kind of introduce the themes that we heard across all the sectors, and then hand it off to the participants from each of the specific sectors that are here as well.
Thanks, Kara. It's Jennifer from the Aspen Chamber. And first, I'd just like to say thank you to Public Health for the opportunity to partner and have this dialogue and have this outreach together with the business community. ACRA and the business community recognizes that we are at a very critical juncture, and it's very important for us to be able to work together on strategies that can be implemented. And as you mentioned, we're all in this together, and to care for our community moving forward. So thank you very much. So overall, as Kara has here on the slide, we heard willingness from various sectors to go and have additional mitigation strategies to help address the solution or the situation. And it's something collectively that they can do together. I will acknowledge that we did not have an opportunity to meet with every sector. It's still ongoing outreach. From who we have heard from, this is what we're hearing, what can they do? The consensus right now among the groups was to not go voluntarily into the red, but a concept emerged to create an orange plus level. So the orange that's being mandated, what in addition can each additional sector do to help stop the spread? The businesses that we talked to acknowledge that each sector has successfully implemented safety protocols this summer that allow them to operate. And reports that they're hearing is that spread appears to be pointing towards informal gatherings and personal behaviors versus certain and specific business sectors. The importance of consistent communication and unified messaging. How can the chamber and the community help to get the same messaging out to all businesses as well as our guests? And how can we work together to implement an employee education strategy and share messaging with our employees about how we all personally take a role in what is happening and what our winter season will look like? The state of Colorado is not capping occupancy for hotels. We should follow the state, and I know we have representatives from the lodging community that can speak to that in more detail. And universal concerns regarding enforcement and compliance of enforcement. Not that we have the solution of how that would be enforced, but to have that dialogue that there is a need for enforcement and what could that look like. And additionally, a consideration for a 10 p.m. curfew community-wide. The restaurant sector has said that they are willing to close the doors and have everybody out by 10 p.m. Events have also indicated that they are willing and able to have events end at 10. So could this be implemented community-wide? So again, everybody is a part of that solution and is helping to make that happen. So, Kara, I don't know if you have a next slide. Some of the strategies that were talked about were staging employee shifts. It's been shared that there will be less public transportation options this winter due to the 50% bus capacity regulation. So how can employers help their employees get to work at different times? Interest and ability to test employees, and from the lodging sector, ability to test guests. There was discussion around that closing restaurants to a takeout model may have unintended consequences of encouraging informal gatherings as people eat takeout in homes. The visitor pledge, which has been talked about, lodges indicated that they're already doing that in a manner. And again, we'll let them speak to that. But there may be a way to incorporate processes that they already have in place with some of these new ideas. And then overall, from many different business sectors, concerns about shutdowns. It's obviously difficult for businesses to reopen, the economic impact to businesses, as well as financial and mental impact for mental health impact on employees. So I will turn this over to Jimmy and Michael Goldberg. You'll see that we work together as a group at the task force meeting to come up with some suggested additional mitigation strategies that could be utilized and for consideration. So with that, I will turn it over to Jimmy.
Hello, everybody. Michael, you're there too? Okay, I think Michael's on there somewhere. So yes, on Tuesday we had a restaurant meeting with the Public Health Department and went through a lot of this conversation that you're reading in front of you now. I don't really need to just read down the list of it, but we do feel that we can add some comfort to the safety measures by doing things like temperature checks on guests and improving the contact tracing. And the bigger questions come from, it's really catastrophic to think of a voluntary situation where you would make the decision to shut down restaurants for 30 days. And there's a lot of obvious reasons for that. I really don't need to go into the economic hardship of what that would mean. The unemployment in Aspen alone, I think, would be between 700 and 1,000 people in a temporary layoff. But that's just the problem, is that would it be temporary? How do you guarantee a reopening in 30 days? What if the numbers don't go down? What if it's not helpful? Then what do we do? And already the state is imposing a shutdown on, I believe it is 12 or 15 counties. So our feelings are, why not see how it goes with them before we start enacting such extreme measures? As it is, we're going from 50% to 25, let alone the unbearable thought of going from 50% to 0. So it's really a proposal that is a pure stop for us as a restaurant group. There are only a small percentage of restaurants that could transfer their business into a to-go business where they could sustain themselves. Obviously, even at 25%, it's a losing proposition pretty much for all restaurants, even though I think most restaurants are able to sustain some level of loss for a short period of time. It obviously can't go on forever without some sort of aid like we got in the springtime. The springtime PPP packages were very beneficial. The city did some programs that helped other businesses very well. We're able to basically limp into the summer. The summer was better than expected in terms of demand without events. And so we actually all were able to maintain ourselves to get to this point. At this point, going to 25% for the next 3 weeks, maybe 4 weeks is okay. It's not a very busy time right now. It's probably the slowest time of the year, but obviously come the 3rd week of December, we would be wanting to go to a higher capacity limit. I see Michael's on now. Michael, let's do this interactively. What do you have to add?
Well, I echo what you have to say, Jimmy, about the concern that on December 20th, there's nothing that guarantees us except, of course, our own actions. And that leads me to say that while I think that the whole business community has been impactful this past summer in following what guidelines we've had to date, I think the piece that's missing, frankly, is how do we impact informal gathering if that's the majority of outbreaks? And at least how do we do that based on what is proposed in red? And sure, as an industry, I can talk to what impact we would have in going from, tonight is when we start our 25%, and we're all doing that willingly, not just because we're required to do that, because we understand the necessity at this time to do something more extreme. But in addition to the items that Jimmy mentioned, testing and so on, I think the idea of when I say testing, thermometer testing, temperature testing, reducing our capacity at tables from 10 to 8, additional things beyond what we're required to do to hopefully be impactful. But at the same time, as we look at the community as a whole, support of I suppose you call it a citywide, for lack of understanding the difference between a citywide and countywide, or what layers or boundaries one would have. It seems to me to add an additional component that would, with enforcement, and that is key, because enforcement, that's something we've been doing as a restaurant community, or at least a good number of us have been doing as a restaurant community. And I can certainly speak on behalf of Matsuhisa and what I've heard from others in terms of their experiences at other restaurants. But so self-policing and self-enforcing is something we've done and will continue to do. But at the end of the day, I think there's something that's got to be mandated. I just noted that California just implemented a 10 p.m. curfew throughout the state in most areas. I know Miami for in excess of a month this summer, when their numbers were spiking, implemented a 10 p.m. curfew. They still have a midnight curfew after spending a little over a month in the 10 p.m. curfew. But those that I know who are in the health delivery sector in Miami have said that was very impactful, and particularly in the informal gathering scenario. So we as a restaurant community are endorsing Orange Plus with a heavy reliance on Plus.
Yeah, there's there's this unknown factor about the informal gatherings. Michael and I talked about it earlier. Back in the spring when we were doing takeout, it was a pretty good portion of our business that was large orders. So there's no doubt that if you go to takeout delivery options for restaurants and you don't spread people out amongst the restaurants, you will just basically promote the type of informal gathering that you're looking to avoid. In the slide that you showed earlier, just on a quick math on that, basically it was 7.7, 15.4, and 23, I guess, 0.1, which is multiples of divisions of 13. So I don't know exactly how many people were in that outbreak that you basically went 3, 2 to 1, from informal gatherings being 3, restaurants and construction being 2, then the other sectors being a single. But obviously, given our nominal numbers in a place like Aspen or Pitkin County are relatively small, a change of 1 or 2 people in a sector could mean a lot. We've discussed that it's really not to anyone's benefit to get into data debating, because everyone wants to claim that it's not us. We're not the problem. So we're not looking to do that from the restaurant community, but we do know that it's our life practice to practice safety for our guests. We do it every single day pre-COVID, and that has only been enhanced since we reopened in June. So we take this very seriously. It's not a light thing. At 25%, it's really spread out. At 50%, it's manageable in terms of us being able to make a living. But we feel that in the restaurant community that we can do our part in helping mitigate the problem. I think everybody's in agreement that there is no eliminating the problem. It's something that we're going to live with either until The vaccines prove to be very helpful, or other measures are taken. But shutting down the restaurant sector, which based on the differences between orange and red, seems to be takes it the hardest, as well as obviously events. Anything that's based on social gathering, which is what our industry is all about. Matter of fact, we prefer the being physically distanced but socially connected way of verbalizing it, because the mental health stress is pretty severe on everybody. The baseline stress of just being in a COVID world is enough. So we really implore everyone to take a real serious look at how we can stay open. I do have a question, which I'd love somebody to be able to answer. How is Garfield, whose numbers are way above all of ours, basically saying no to the state, and they're going to stay in yellow?
Well, and maybe we'll take a quick moment if it's okay, because I noticed Mara has been able to
perfect.
join us from the state. Jimmy, if you don't mind us just kind of doing a quick pause here, and I think Mara can answer that question and then
would love
just
to hear that.
share. Okay.
Hi, Jimmy. Garfield County received their notification that they will be moving on the dial yesterday, and they were moving to orange. And so they did receive their letter. I had their meeting with their Board of Commissioners and shared with them that we would be moving them to orange per the dial metrics.
Thank you.
So question for you, Mara. This is Marky. It appeared before they got their letter that they were interpreting that they could choose whatever color that they wanted to go to. And in an earlier conversation with our new mayor here in Snowmass, I indicated I don't think that is an arbitrary decision at a county level. So I do appreciate the fact that they did receive their letter, and thank you very much for sharing that with us, Mara.
Thank you, Commissioner. I appreciate that. Yes, that is correct. That a county is placed on the dial per where their metrics lie. There are a few caveats to that, and we always want to work collaboratively and in partnership with our counties. I'm only a resident of Adams County. I don't have the pleasure of living in Pitkin, and I want to make sure that we are working in partnership and making sure that we're doing what's best for the residents of Pitkin County.
Any questions for Mara? Mara, you were just listening to the restaurants come back with some of their recommendations, which is a little bit north of orange of what they're recommending. I find that is very, very helpful to help us with the mitigation in our community.
Well, thank you so much for that. And again, I apologize I wasn't on right at 3:30. I had a conflict and busy days, but I greatly appreciate this opportunity to come and talk to Pitkin County and the measures that you all are taking place. We understand that we've just moved Pitkin from level yellow to level orange, and that's implemented tonight, and appreciate the steps and the collaboration that you all have taken. You know, in some conversations that we've had with the LPHA directors and others, and really where Pitkin County's numbers are, do show that Pitkin County is solidly right now within our red metrics. We are moving counties that have been in those red metrics for really 14 days or more, and you haven't been there that long. We've got you sitting in the red metrics for 6 days, 6 days currently. And so with that, I appreciate the level orange plus. I think that that's a really inventive and collaborative way to have mitigation strategies, and really recommend you take those. But what's more is to look at level red. With your metrics, I imagine that I will be here again in 8 days talking about that the county will need to move to level red due to where the metrics sit, unfortunately. We do say in public health that, the sooner that you can make drastic changes, the more effects that you're going to have. And so for the pain that we might have right now and experience, that means that we will have a much better, hopefully, end of December and January if we make more drastic measures currently. And so at this time, again, you have not been in red for the full 14 days, and I want to respect that, but we really would encourage that red is established and sooner rather than later if the metrics keep going in that direction. But greatly appreciate the really robust, Orange Plus that was developed. And if that is the route that you are encouraging, I hope that those mitigation efforts do change the tide for Pitkin County. But know that the incidence curve does show that we will probably need more drastic measures. I see that there's a question, if you don't mind me answering it, about the movement from red to yellow or back from orange back to yellow. Once metrics are established for 2 weeks in the dial, we then will move you back to those appropriate level metrics. And so once you've established your orange metrics again for 2 weeks, those metrics will then be moved into, you would then reestablish that into that level. That includes if you've lowered and you've been able to reestablish into yellow metrics of what that looks like.
Questions for Mara? John?
Marky, is that okay if so Mara, just to be clear, because I think we didn't understand the mandatory, I think, movement into the red earlier this week. And so the state at this point is for counties that have one or more of the 3 metrics in the red zone for 14 days or more are being required to go into the red.
Yes, the state will move you into the red.
Okay. Yeah, that's a little different than I'd understood earlier. I think that may that's important information for everyone to understand. Thank you.
And we do want this, again, I don't mean to abuse the word collaborative, but we do this with hopes that the community is supporting these public health efforts. And that is really why we don't want to come and say, nope, the state is doing this, come on. Instead, these are the reasons, these are hopefully the outcomes that will happen. And without community support and together and a partnership, we won't be successful. And we really need that. And so that is really where I am, the conversations of the state never wants to be the one demanding. We want to work together and making sure that we're making the best decisions we can for Pitkin County, being led with your public health department and us supporting and making sure that we're keeping your constituents safe.
Mara, just on clarification of that as well. So what we had been told before is once you move into a certain color, it's looking at a 30-day kind of reevaluation. So if we were to move into red in X number of days, are we locked in for 30 days or do we have some flexibility okay.
That's a great question, Karen, and really appreciate that. If your metrics have been reestablished within that, then we can definitely work without those 30 days. I like to work on a light at the end of the tunnel and having assurance that the state is going to be reevaluating where we are on those metrics in those 30 days, I think is important to share. And so we are going to be reevaluating anybody who's in the red dial the week of December 18th, because again, we think that is valued to make sure that we're being good partners for those counties as well. And so that is what the 30-day clock is to make sure that we're doing our due diligence of making sure that these are still appropriate measures. If you're to establish different metrics earlier, especially if you're able to reestablish yellow or orange, then we can move you sooner.
Greg?
Right. Mara, we're so glad you're here. Thank you. Our community extends to really it's 3 counties are in our community, and maybe even 4 if you're talking about people going as far as Mesa or even over to the North Fork of the Gunnison, where people commute in to our community to work. So the question I have is, it's not always easy for counties to get along and agree on what level they should be or what restrictions they should put in voluntarily. You know, what our community can do may just be completely different in Garfield, for instance, or Eagle. Or so I'm trying to get a grip on this. We're talking about counties here, but really our community is so much bigger. Is the state going to help us if we have to go into a restriction or come out of one in the adjoining counties, our bedroom communities, for instance, where a lot of workers come from? Are we going to get some support in nudging them along also, so we can keep everybody in our working community safe?
It's a really great question. And so Mesa County has moved to red. We're having lots of these conversations as well with other counties. You've heard that Garfield County has moved to orange. Gunnison County has is also moving outside of Protect Our Neighbor and is going through the dial system as well. And so we agree, a regional approach is a stronger approach. You saw Summit and Clear Creek move also to red as well, while a different area of your county region definitely does have impacts. And so I appreciate those words, and we will support those regional talks.
I have a question for Mara. Mara, when it comes to the 3 different metrics, right now our metric is an incident rate that is pushing us over into red. Is that correct?
That is one of the metrics, yes.
Right. Our other 2 metrics are still more comfortable, especially the hospitalization. So if we continue with a high incident rate, but it's not translating because maybe we're just a healthier population than other counties, into serious illness that needs hospitalization or death, how does the state take that into account? In other words, I'm a restaurant owner. So if we go into red and I have to close my restaurant, which potentially puts me out of business if it continues through the winter, because I'm assuming if you stay in red, you're closed, other than doing takeout. And frankly, outdoor dining is not really that comfortable in the middle of winter up here in Aspen. So if that's the case, but we're not seeing it translate into the other 2 metrics of positivity rate or hospitalization, how does the state justify closing restaurants as part of a mitigation when it's only resulting in higher incidences? Because this virus is here, it's not leaving us.
So we've only, we take into consideration all of the metrics when moving a county. Yes, and with red, we're really taking into consideration all 3, especially the hospitalization metric. And so, if we were to move into the 10 days, that would definitely be a consideration. Again, hospitalizations are a really late lagging metric. So it's after there's already very widespread community and that there's already something wrong that hospitalizations really start to declare. As we've seen Pitkin and move through, I think my major concern is that Pitkin County just a week ago was very comfortably, in the lower orange levels, and in the last week and a half has really stormed through orange and is now solidly in the higher echelons of red. And so that would be my concern, is that we're seeing just exponential growth and what that looks like.
But you're just seeing the growth in the incidence rate, right? Because our
Currently,
hospital
that
rate
is what I was looking at.
Our hospital rate still is pretty much as low as it can go. And I understood what Kim had to say at the beginning of the call. I'm not disputing her feelings or thoughts about that. But the reality is that we do not have a hospital issue at this point. And if we were to continue having that low hospital rate and not see a translation of our incident rate to that, would the state then consider keeping us in orange longer, even if our incident rate is high?
We would definitely be open to having a conversation, because we do look at those 3 metrics, and that's what moves you on the dial after those conversations with your hospitals and local public health and others. So.
Okay, good. Because I was getting the impression that there was a little bit of a submission going on, that if that's the way it is, that's the way it is. And frankly, as business owners and as a representative of the business community for restaurants, our gloves are off a little bit. We need to fight for our livelihoods. And if we can keep healthy, which I think is something that not many people are talking too much about, is that if you have a good immune system and you stay healthy, chances are we can live with the virus and not run into these deeper problems. So thank you for your time. I do appreciate it.
Well, I really appreciate everybody else's time. Thank you so much. Again, apologies that I was late at 3:30. I appreciate everybody waiting for me and letting me come on at the end. And I just really appreciate this community support of Pitkin County Public Health. It is a incredibly challenged during this pandemic and what they've had to go through. And so any support that we can give to our local public health departments, we're all going to miss Karen and her wonderful leadership, but you're in good hands with Jordana. So thank you all very much. I really appreciate your time.
Mara, sorry, just before you go, I feel like that last answer that you gave Jimmy kind of opened up the door a little bit for the conversation of what happens if our indicators are in red for 14 days. Can we just get a confirmation that if our indicators, even one of our indicators are in red for 14 days, what the steps that the state will take will look like, so that we can have an informed conversation right now about where we want to do and where we want to move locally today?
Definitely. So there's no doubt that with your incidence rates and the curve that it's on, we're really seeing quite a steep change in cases. And so if those continue, and if your hospital metrics start to become stressed, we will move you to red at that 14-day mark. If your hospitals are still in the comfortable, and we'll call them and have that conversation, I think that opens up a different side of conversation of what that looks like, because we do want to confirm of where your hospitalizations are. We take in all three metrics. And so I can't guarantee what will happen at that 14-day mark without knowing. I don't have a crystal ball to decide what would happen with your hospitalizations or percent positivity. But where your incidence rate is, that it's solidly in that red area. So appreciate the time, and I look forward to talking with you all again soon. Take care.
Thank you very much. I don't know about you, but my tummy is doing flip-flops right now. It's scary. Oh, Kara. Do you have another industry that'll be speaking?
Yeah, sorry, I'm just laughing of like segueing back to where we were. It's kind of I'm with you, Marky, it's a big piece. But we'll continue the conversation. And so I don't know if Lindsay or Raleigh, if you're driving the slide deck, thank you. And so moving on from restaurants, I think we want to hand it over to the events and arts and cultural. And I know I saw Elizabeth and Jim both on the line. I'm not sure who would like to go first.
I'll jump in, and then I'll pass it off to Elizabeth. Thanks very much for having us here and for all of your hard work in participating in this. So the arts organizations, there's only a handful that are active or semi-active in the winter, as opposed to the summer. That's ourselves, Jazz Aspen with Jazz Cafe. Aspen Theater has been doing planning to do things, I know, this winter. I know Aspen Music Festival is planning to ramp up or try to ramp up shows this winter. And I just want to say a couple of things about our particular sector, what we can do and maybe what we can't, but certainly what we can. All of these things that you have here on the screen about working with the curfew, temperature check, contract tracing, reducing table size, all of this is fine. There's no issue for us. One thing I do want to point out about at least these arts organizations, we specifically, and only the shows that we did as we did them this summer, are very, very, very controlled. And that's the only way we would consider doing anything. Masks were mandatory. Tables were separated. Everything was reserved and separated, and people did feel comfortable. I know that the experience of the other organizations was simple. We did what I think is compliant with all of these standards. I know we did, and it's the right way to do it. And we're of course completely supportive of that, and we'll continue to do it. I think the only place where for us, and it's somewhat similar, although we're not the same as restaurants, and I don't, restaurants are every night, food is every night and every day, art and music is every night and every day for some of us, but maybe it's not quite the same. But I would say that as far as the numbers are concerned, and these occupancies, the difference between orange and red is the difference between open and not. We know that we can manage with 25% of capacity and even lowering the maximum target of people from 50 to 40, which is a strain, but manageable. Once it goes down to closed is closed. Zero is a great distance from 40 or 50, but the problem is there. And as far as where we're planning, I can only say in the case of Jazz Aspen, we decided months ago to not schedule any shows in December or January because of fears of just this spike happening. I can't speak for the others. We have a plan, and we hope that we're able to execute it. But that plan obviously is tied in with the industry and with the community. We're prepared to do everything if we're able to open, and all of these things make sense. And we'll do it. We'll do each and every one of them. And I do think some of the other things that were spoken about earlier, as far as ramping up what can be done with travelers, seems like I mean, in terms of travelers having to be tested, that seems to me to be happening everywhere. I can't imagine why a community like ours would not be doing that. And then the other point, and I'll say, and then I'll pass it off to Elizabeth. Obviously, we see this spike happening, and it's not happening during a time when there's a great many visitors. So we know over and over again, we've heard it about how it all comes down to this, not all, but the individual behavior, individuals and where they are and what they are. I think each of us as organizations, I can say in our case, our office is closed. We are only working remotely. We are not doing any kind of gathering. And I think it's important that each of us do that with our employees and with our friends. And that's it. That's what I have to say. And we'll do everything we can to be part of it. I like the idea that there's going to be a greater message and coordination. If this doesn't drive us to coordinate our message, it's probably not possible that anything would. But I'm glad to hear that we're on that track. And as a community, we need to, this is past time. So I appreciate all the effort. I'm done. Elizabeth, it's all yours.
Thanks, Jim. And I just want to start off by saying thank you to everyone. Being in the event world since March has been like dodging bullets and trying to maneuver thoughts, expectations, feelings, support, minimizing exposure, which I know we've all worked hard on. But when you look at the graph and look at the formal versus informal gatherings, it's obvious we're social beings and people want to be together. So on the event side, we've really been working on what can we do to minimize the exposure, all while supporting small, meaningful gatherings. The event world has turned into last minute. It is much easier for us to work in spaces like restaurants, the hotels, that we can control the capacity, we can control the numbers. I think, speaking on behalf of the event crew, we believe wholeheartedly in that 10 o'clock curfew. I think what we struggled with, and Michael knows this, Jimmy knows this, we struggled with the event that we booked can then show us in other areas that there were still people at the bars. There were everything we were saying we weren't allowed to do. They could go 2 doors down and perhaps do it. So I love the idea of the curfew, of us all being on the same page, you know, last call, and knowing that at 10, the hard shutdown is the hard shutdown. And 9:30 will serve, and 10 o'clock events and restaurants and hotels are all on the same page. So we're not sending out this mixed message. Very easy for us to do temperature checks, very easy for us to have contact tracing because we have all the guest counts. We have all their names, phone numbers, addresses. We love the Orange Plus, and we align with Jim and with the restaurants in 0 is 0. So having a percentage, calling the Jerome, calling the Nell and saying, you know, what is your capacity size? And can we break it down into these 8 tops that are 6 feet apart, or 6 tops? You know, I think the event world is willing to really jump on board and do whatever it takes, because the more formal events we can do, the less informal gatherings, which is that huge piece of the pie. So we love partnering with the restaurants and the hotels. It is scary going into people's homes with their rules and having to lay down our law of, you know, EKS events, Bluebird, the Nell, the Jerome will lose our license. And you don't want someone to get sick on your watch at your informal gathering. So the capacity indoor 25% square footage, we are so great with. If we have to go, we feel the same way, you know, Jim is, and the same way Michael and the restaurants are. 40 people maximum. If we have to go down to 30, we go down to 30 based on the room size. We go down to 20 based on the room size. Outdoors, you know, we don't really need to talk about that right now because of our weather. So we're not in the warm climates where we can sell someone on a great outdoor event. And then, you know, with dealing with a lot of what EKS events does is our charities, you know, really encouraging them to do the Zoom boxes and the smaller, and to order from the restaurants and make it happen, but not breaking any of the rules. And that's what I think, as if we come together as this community and really encourage the smart gatherings, we feel we can stay out of that red of 0. And I think that's all I have. If anybody, you know, has any questions for me or comments, or any way the event community can help in the other areas, I will tell you that Tori has been magical to us all summer in navigation of our events. Jen, Liz, Sarah, the chamber is instrumental. I think I probably talk to them 4 or 5 times a week to make sure what's happening along, you know, the way we're doing correctly. So I just appreciate everyone and all we've done to help get us through the events through the summer. And now we need to give back for the winter.
Excellent. Thank you very much. Who's next, Kara?
Great, thank you. We don't have a slide, but I do know we have a couple of representatives from the lodging community on, and I want to give them an opportunity. And I know Donnie. Yeah, go ahead, Donnie.
Yep. Thank you. It's good to be here today. I guess I'll just jump right into trying to, I think, assist getting our narrative maybe back on track. The lodging community is always, we don't take it for granted. We certainly take it seriously, our partnership in the community and where this goes. We've certainly put forth a standard of excellence to operate with through the summer that went above and beyond what the minimum standard needed to be to make sure we could keep our team members safe, make sure we could communicate with customers coming to Aspen that they could come here and be safe. we continue to move forward in that direction today with that same level of standard, to go above and beyond whatever the minimum expectation is. We do strongly support an Orange Plus. We certainly realize that we are up against it from a time standpoint, that we've got to take critical steps as a community to bend this curve in the right direction. And we're happy participants in that. Many of us have already taken steps to throttle occupancy limits. Ski company's done that. I know the W has done that. The Gantt has a standing metric involved where we're holding true to a 48-hour window in between a departure and arrival. We do that for a number of reasons, but one of the reasons is that it helps us operationally maneuver, understanding what kind of transportation demands we're going to be dealing with this winter, expending money to make sure we have HEPA filters that we've installed into our vans and our office spaces. So there's really no measure that we won't go to try and keep people safe and be part of the solution in the community. I will say that one of the things that I realize is probably a community concern is a massive onslaught of occupancy that hits the community. I will tell you that we work in concert with all of these things. The lodging needs to be occupied in order to support the restaurants and retail and all of the activity. The opposite is true. If there's restrictions on retail and restaurants, then we don't get the occupancy. And that came to a screeching halt this week. I would tell you that we've certainly fielded far more cancellation requests this week than reservations. So any momentum that we were seeing build really stalled out this week, just with the broadcast of the information that's going on. Acknowledging that there's a massive increase going on nationally, and we're seeing the same thing here, and people are concerned, and they have every right to be concerned. And what can we do to try to get this back under control? So I would tell you that we are willing participants in a testing program if that's where that needs to go. I have some of the same reservations that have already been spoken about, but it's something that we in the community, the lodging community, talked about. It needs to be in lockstep with the public health department, of course, but whatever we can do on those fronts to try to move this in the right direction for the community as a whole so we can stay safe, we would want to do. I delivered a very strong message to my entire team this week that everybody needed to consider being on an isolation order that was allowed to go to work. So from work, you go home, and trying to impress upon them a personal level of commitment that we all have to take in order, if we're going to do this collectively, to bend these numbers in the right direction. It's a point of needed immediate action that we as a community need to respond to. So I don't know if I can kind of stress that any larger than I just have, but a lot of things are happening between, we've got small lodges, we've got very complex resorts, and a lot of things in between. And within that construct, everybody is participating to those levels and those standards within their operational systems to be safe and to make sure we can bring people here. But I would say that we're probably not going to see the onslaught of occupancy that we saw this summer. Even with what was on the books already and the pace that was coming in, I didn't see us even getting full over the holidays before we hit this week. And any kind of stall that we begin to see begins to erode even further down the line. So even though we've got some controls in place to help mitigate that and allow us to maneuver operationally with those demands, I'm not sure we're going to get to those levels. And that's something I think that we all just need to be mindful of, that we're not going to see the same kind of demand that we saw this summer. I'm hoping that we can get through this and bend these numbers the right direction, give people some comfort to come here and keep them safe, and have enough business activity that we can all kind of get through this together. But I don't think we're going to see the onslaught that we saw this summer. Jeff, did you have anything you wanted to add to that?
Yeah, thanks, Donnie. Very well said. And I think you covered many of the topics and things that I wanted to express. I mean, the hotel industry, certainly here in Aspen and even in a larger scale statewide and nationwide, we've had the benefit of relationships with not only our national chain partners, but also organizations such as the American Hotel Lodging Association, Colorado Hotel Lodging Association, and all of these organizations have developed from the very beginning very strong sets of protocols and standards for cleaning, for occupancy, for employee protection, for guest communication. And I think that demonstrated it. If you look at the data, not only from the Colorado Department of Public Health and Environment, but also the graph that was shown earlier in this presentation, that, you know, the outbreaks from the hospitality segment have been minimal or almost non-existent, even given the larger volume of business than we anticipated these last several months and through the summertime. And I think that demonstrates that the hotel industry, certainly in Aspen and beyond, has really been kind of the leaders in making sure that we're maintaining our commitments to our standards and our protocols. And I think that if anything, we'll continue to look at those and add to those as we move forward into the future. You know, we're very, very respectful of and realize the importance of this and the severity of this issue. And no one wants this to be, you know, minimized or have this issue be minimized than the hotel segment. You know, as Donnie mentioned, you know, many of our properties, we have a variety of different properties in Aspen. We have everything from luxury properties with full indoor facilities and indoor hallways and elevators to smaller family-owned properties with outdoor exits and entrances and open hallways and no elevators, and giving those properties the ability to manage their operations in a fashion that's best for their operations, to provide safety for them and their employees and their guests is an important part of what's made us successful, and not imposing kind of a one-size-fits-all on our industry. You know, we've had great partnerships with the government and the community in terms of participating in programs that have everything from distributing gift cards that benefited other retail segments to, you know, working on, you know, testing and being supportive of any additional testing measures or communication pieces that can help not only with our own internal staff, but our guests. I mean, the hotel industry, you know, we have a unique opportunity to reach out and be in communication with our guests prior to them even stepping foot in Aspen. And I think that gives us a great advantage to share with them the importance of being committed to the 5 steps of containment, being aware of what the environment is in town, what the rules and regulations and restrictions and masking policies are, you know, and then following that up with, you know, the experience while they're here and ensuring them that they're going to have a great, safe and successful stay in Aspen. You know, we're very much hand in hand with the community to make sure that all of the measures that are being explored at this meeting are implemented within our own organizations. And I know that I speak for my organization. You know, I had that same strong conversation with my team today at our managers meeting, and we also have hotels in other states that, you know, that aren't taking this you know, this pandemic and the impacts as seriously as Colorado, and certainly as much as Aspen is. And, you know, it's difficult to have the same level of attention in a state that doesn't have the support as it does here. But if anything, it makes us stronger to be able to implement those standards and protocols. So I think the hotel industry, certainly in Aspen and beyond, is well prepared to weather this next phase, to be supportive and to help educate and inform our guests to be better guests and better visitors and be stewards to the Aspen ideal. Thank you.
Thank you, Jeff and Donnie. And then I also know we have a couple of representatives from the medical field that were going to speak up as well. And I know Dr. Holmes is on the line and Dr. Bernard. I don't know if either of you would like to share your thoughts.
Sure. Yes. Yeah. Thank you, everyone. So I think I know many people on the board, and I've been on a couple times. But so my name is Brad Holmes. I'm a physician at Aspen Valley Hospital. I'm internal medicine and pediatrician, and work predominantly, or I work exclusively at the hospital in the inpatient setting. So taking care of the patients with COVID who are hospitalized. I work predominantly at Aspen Valley, but I also do work at Valley View occasionally. So I'm kind of looped in on what's going on throughout the Valley in terms of hospitalizations and things like that. So, and I just, I appreciate everyone's time, but I just want to kind of reinforce what Dr. Levin and Josh said. I'm concerned. We know that things are not bad currently at Aspen Valley Hospital. In fact, we're doing fairly well, but we also recognize that we're not an isolated community, and we are a small hospital with a lot of limitations, and we can easily be overwhelmed. I think we saw from Dr. Levin and Josh that the statewide cases of hospitalization have significantly increased recently. We've already surpassed the statewide hospitalizations that we had at the peak in April. And although we're doing okay at Aspen Valley Hospital, that's not really true locally, and we are seeing some staff shortages here. We're seeing a number of clinical staff who are out because of quarantine or isolation. And I would be extremely surprised if we were not affected very soon by this. I can tell you down at Valley View, just for comparison, in September, October, at the end of September through October, over a 32-day period, they only had 7 cases of COVID. Just in the last 21 days, they've had 25 cases. And, we need to remember that, that 25 doesn't seem like a lot when they're, I think, roughly a 70, 75 bed hospital, but these cases, they stay for several days, if not weeks, I think I read that the median was 5 days, but there's a number of people who will stay for several weeks if they're on ventilators. So those cases quickly build up. 1 month ago, they basically had either none or 1 patient at any one time. Now I think as of today, I believe they have about 8 cases currently hospitalized, a couple in the ICU. And this is just over a quick period of time, and we know things change. They don't just change linearly. They're not going up slowly. They increase exponentially. So, it's concerning that things have already happened this quickly just in the last couple of weeks. We also saw the incidents just in the last, I forgot, I wrote it down somewhere, but the incidents went from the low 200s to over 500 just in a 12-day period. So things are going up quickly, and it's concerning because, again, we are in a location with limited resources, and we're a great hospital. Aspen Valley is a great hospital, but we're still not going to be the preferred place if you get severely ill, and especially if you're on a ventilator. We do our best, but you'd be better in Denver, at Grand Junction, at these bigger hospitals that have dedicated ICU trained physicians and teams that take care of patients on a daily basis that are on complicated vent settings and things like this that we just don't do on a regular basis. So, I just don't want to. I want to make sure that that's clear, that if things continue the way they are going, that I can't imagine that we won't be affected significantly. And we know that things are going to get worse. Even if changes are made right now, there's a delay in how they take effect, because the hospitalizations generally occur 10 to 14 days after the actual infection. So what we're seeing now at the hospital, will not have what's done now won't have any effect on the hospital for a couple weeks. So I think those are the main things I kind of wanted to just put out there. Just remember that, if we wait for AVH to start to see signs of reaching capacity, it's essentially going to be too late because we're such a small hospital. So thank you everyone for your time, and I just wish everyone the best. This is extremely difficult times and a lot of really difficult decisions to be made. So.
Kat, I see that you had your hand up.
Yes, thank you, Marky. This is Dr. Bernard, and I'm one of the full-time ER physicians at Aspen Valley Hospital and also the chief of the medical staff. And I would just like to remind everybody that, hospital capacity is not just who's admitted for COVID. I hear a lot of people saying, oh, well, if I get COVID, I probably won't get that sick. I'm healthy. Our community is healthy. Hospital capacity, we reached 2 yellow metrics for COVID in the last couple of weeks, one for testing, and that's really because the increase in community tests, the outpatient setting, and also for healthcare workers out. Our own physicians have been affected, as well as members of the other frontline healthcare workers that we need, housekeepers, everybody we need. 15 out at once is a lot for our small staff. So in those indicators, hospital capacity has been affected already. As far as admissions to the hospital, Brad kind of touched on this. We haven't had a lot of COVID admissions, nor have we had a lot of transferred patients. But I did just meet, as the chief of staff, with one of the other hospitalists with the 5 hospitals in our region just last week. That includes AVH, Vail, Valley View Hospital, Rifle, Meeker, all of us being hospitals with limited capacities for certain illnesses. So basically, none of us have the ability to care for very sick pediatric patients who need ICU care, generally need to go to Denver. Patients who have major trauma, especially trauma that affects the brain or the spine, cardiothoracic or vascular surgical emergencies, as well as things like nephrology. None of these hospitals really have the ability to care for these things. And all of us are already experiencing difficulty transferring patients out for non-COVID illnesses that require intensive care units because the cities are strained. So I just want to echo what has been said by so many parts of this conversation already. We are not just one entity. We are not just in one bubble. We're all part of this bigger whole. And for the healthcare system, especially when you work at a small place like this, there are many things that we transfer out on the regular, things that are able to be cared for at other higher levels of care that as systems get strained, we will see difficulty transferring as well. So please, when you think about hospital capacity and risk, you have to consider that we're one part of this greater whole. Thank you for allowing me to speak, Marky.
Thank you, Kat. Kira?
Great. So I want to thank everyone from the community that took the time today, as well as all this week, to help with these conversations. I know really ACRA and Snowmass Tourism and SkiCo really helped take the lead. So I just want to offer it up to Mike and Rose for any closing statements before we hand it back over to you, Marky.
Mike?
I was trying to wait Rose out. You going, Rose? You want me?
I'm either way, Mike, up to you.
Go ahead.
Well, I thank you, everybody. I think this has been such a thoughtful and collaborative discussion. So thanks to everybody. What you heard from the restaurants and the hotel representatives echo what the Snowmass community said. One thing that I don't think we talked about in any of the sort of town hall kind of conversations that I participated in, but listening to today, I just throw this out there is in the Orange Plus, should we consider making the informal gathering size none? Because if that is one of the areas, and we've got a big holiday coming up and there's still lots of talk about people getting together, and maybe that is one of the options of trying to, again, this is coming from me. We didn't really talk about that because I think each of our industry sectors was looking at what they could do. But I tossed that out there. And then just another comment about the community-wide testing. I know that a cruise ship recently tried testing in the Caribbean and it didn't go well. And I'm happy to share some of that information and that was a very, very controlled environment. And they wound up, I appreciate an extra layer of cheese concept. Swiss, it's got a name, but the layering, I don't know what the name is. But anyway, I think that we could look at some other places that have tried it and see what we can learn from it. I'm not dismissing it. I just think there's lots of places to learn. That's all I had. And thank you.
Thanks, Rose. I've got the feeling we're short on time, so I'll shortcut my comments. I just want to thank this board Not sure you knew what you're signing up for when you signed on to this board, well before COVID, I assume, but really appreciate and thank you for your service and for keeping us all safe. You know, if you go back to the initial response, you know, it's really been stellar up until now. And I know we got some issues now, but I think if you go back to the shutdown, you know, I was on the phone with John Peacock and Dave Ressler and Karen and others, and we were talking about, you know, what the right thing is. We were talking before then, and we actually made the decision to shut down before we were told we had to. But that was, you know, thanks to that collaboration which started then, and then, you know, obviously everything we've been through over these last several months, you guys have really led the way and upheld your role to keep us safe and keep us informed as a community. So really applaud you and appreciate that. And likewise would say that about our partners in the community and those who have spoken. I was on a call recently with a bunch of travel operators and tour operators and travel agents, and they were universal in saying Aspen handled this right and so much better than any other community we interact with. So those guys emphasize safety. They emphasize, you know, the guest experience, getting people home safely, getting their money back, doing all those things, which to me sort of exemplifies, I think, our community approach. And I'm going to say that I think the business community's approach to this, which is, yes, we want to get open and stay open safely. We think it's critical. We think it's important, but we want to make sure we do this in a way where we look back and we're proud. And we look back and we said, yeah, we did it in a way that upheld our values as a community and our incredible standing as a global brand. So thanks to everybody that's been on top of this, pushing it. And again, especially thanks to the staff and everyone on the board. You know, just quick update from a SKICO perspective. Thanks again to the support from the county staff. We did recently get approval from the state to operate as of Tuesday. And don't worry, I can assure you it was the most rigorous process in the entire state when I speak to our peers in other counties. So again, thanks Karen, John, and all of you. And we sincerely appreciate the letter of support and for making us better. It's 53 pages. I won't go through that here. I will say that we hired Snow Engineering, who's probably the best ski area planner, and said, okay, here are the new inputs with the social distancing requirements. How does this layer into the way traffic flows? And they came back with a pretty detailed plan, and we have a really good plan, I think, to make sure we can maintain social distancing and avoid those bottlenecks. As we all know, once you're up on the hill, it's fine. It's the getting to and from and the in and out. So we've got a lot been happening there. We're working with a company called Job Site Care on the employee safety management, particularly on the employee housing side. We are doing pre-arrival testing with them. We're doing some ongoing screening through Job Site Care. We're doing all kinds of stuff by building. We've got the mitigations in place when it comes to air handling. Went through and audited all our facilities and upgraded systems where we needed to, and addressed all of those things. And then, finally, I would just say we are taking this seriously. I mean, I appreciate hearing from everybody, again, all the experts here. Nobody is minimizing this. I sent a letter out to all of our employees Sunday night. It went out to the community on Monday and got posted on social and out to our guests. And I'm sorry, Donnie, that's probably one of the reasons we're seeing more cancellations, because we've said that from the beginning. We've got to be transparent. We're all skiers. We all know that we've got to take responsibility for our own safety and our own decisions when we get out there on the hill, and it really applies to COVID. So we are very much trying to tell people that, hey, if you're going to come here, it's your decision. You've got to follow the 5 C's and make sure we can get open and stay open, because we're all in this together. So since we saw the spread continue, since we saw this conversation around Orange Plus we've gone back and we're looking at ratcheting down some things in advance of opening. I won't go through them in detail here because then it gets out in the press and then my team hasn't had the website updated and all those things yet. So just to assure you that we're looking hard at that next level of ratcheting down. One of maybe the best example of that is we sent out an email and notice to all of our pass holders and said, as we said, a reservation system is possible. Given the current rate of spread, a reservation system is likely, and we're working hard to stand that up. Totally committed to some sort of visitor pledge. If that's an affidavit, David, I love that conversation earlier today. We're ramping up the employee pledge. We're doing that in concert with Sarah Ott actually shared what you guys are planning on doing in the city. And so we're talking to other leaders about that. In short, I feel like everyone's done such a good job to get reopened, to stay safe this summer. We've got this little spike. We can and we've got to beat it back. I urge you to go to this Orange Plus, and I urge you guys to push on enforcement, push on this personal responsibility side of this, and see if we can't bend this curve in time to save Christmas and save the season. We're all in. I think everybody you heard from is all in, and I'm optimistic and hopeful that we can get there. Thank you.
Thank you very much, Mike. Do we have any other speakers, Kara? Or
yeah, thank you, Marky. We do have a couple law enforcement folks that were able to join, and I didn't know if they had any parts that they wanted to share.
I see Joe's on.
Yeah, and I think actually we had invited our law enforcement reps more if there were questions. We had discussions about enforcement, but Joe, I'd never want to preempt you with a colorful comment of some flavor.
Oh, I'm perfectly capable of my own colorful comments, John. No, I'm just here to answer questions. I think everything has been said. So if there's any questions for myself, Snowmass Police or Aspen Police, and I think Basalt is also on, we're here to answer questions. If not, we could move forward.
I would just note there's a conversation yesterday about how we can partner with law enforcement, also the limitations, quite frankly, that law enforcement has in enforcing some of the public health orders. So we knew that had come up at previous meetings, so we wanted to make sure these folks were available.
Could we articulate those limitations? We see a lot of people asking for more enforcement, but I'm not sure what's possible. I think back early on a contact tracer back in the spring, our previous contact tracer told us about Crested Butte or Gunnison, who were able to shut down the pandemic then, but they had police standing at the entrance to town, keeping people out or keeping people in. I don't know if that's possible any longer or desirable, but how far have we come from that? But I don't know what's possible. What I hear is that we don't have law enforcement who can enforce on some of these concerns we have. And I hear the community asking for enforcement. I'm just wondering where the gap is and if we can articulate that.
Well, Greg, I'll start, and then of course, Dave Hively or Alex or Bill Lynn could add on to it. I think I'll start with back what Kim Levin had said. We have to do all we can to protect our public safety resources. I mean, it's important for me to keep police officers healthy. So we're really trying to avoid any kind of calls we don't have to go to that may give us an exposure. And that would mean a gathering of say 15 or 25 people that a police officer goes to risks exposure to himself and the rest of the police force and sidelines us, which is a much bigger problem than anyone here would imagine. I don't know that that we have the manpower to answer these calls. I did recently ask, and I'll ask Alex to correct me on the number if they're wrong. I think, we keep hearing anecdotally that there's hundreds of violations and there's people out there that are thumbing their nose. I think we've had under 30 calls for police contacts for public safety or public health order violations. That's not a tremendous amount. We've talked in the past about turning this over to another county agency, who that might be. But exposing police officers for code violation is not something that I'm not interested in. In fact, back in March, we limited all traffic stops to avoid unnecessary contact with the public that may expose us. I'm not going to get into any kind of tactics or how many officers that we have out right now with COVID or with under an isolation order because they've had an exposure. I need to protect the staff to worry about the bigger stuff that might be going on. And not that COVID isn't the biggest thing in the globe right now, because it is, but I also have to focus on things like lost people. Billy has traffic and enforcement problems of his own in the city. So I think that's where I'll leave it. I don't know that it is any of our jobs to do this, and we prefer, and I don't know a better way to say that. I know that sounds impolite, that it's not my job. I wish I had a better way to say it, but I think we're all decided, the chiefs and I, to stick with the educate instead of enforce on this. So I'll turn it to any of the other three gentlemen that are on from other agencies to speak if they'd like.
I don't see anyone coming on.
Just real briefly, one of the things that we talked about yesterday in a smaller group was what the expectation of enforcement is. And part of the discussion came to the idea that as a municipal police agency, we're not even sure if we can legally enforce the county public health order. So we don't even know if we can write a ticket for that. Just to echo what Joe said, I see us as public servants first, peacekeepers second, and enforcers of anything falls way to third. And we're successful in what we do because of those things and because of that pecking order and education and that service level comes. We get a lot more compliance and a lot more benefit from that than any sort of enforcement. And an example was if we did come upon an informal gathering of 20 people, is the expectation that 20 people get tickets, and it's just not practical. So a better understanding of what the expectation of enforcement is needs to come out before we can even realize if we can do it or not.
So piggybacking on what Dave just said, in the city of Aspen, we have done somewhere about 8,000 contacts of people trying to educate people about mask ordinances. We have had, I can't give you a number, but we've had an incredible number of contacts of people who are in gatherings in parks and who are violating various parts of the orders. And we have educated them, we have sent them on their way. So you are actually getting enforcement of this in the context of the way we do enforcement. But this is not a carrot and stick type situation. I keep hearing these requests that suggest that somebody needs to bring the stick and start hitting people with tickets, as you will. But I think the greatest successes we've seen in Aspen have all been about the carrots being removed. When restaurants were shut down early, town empties out. There is nobody to even enforce it on. So just as one example, I think you remove the carrots and really the stick becomes that sort of thing that we use in the extreme circumstances, the way we have up until now.
And Billy, just to tag on to that, to offset or to compare your 8,000 contacts, the Sheriff's Office, since March 8th, since we started doing this, the Sheriff's Office has had 220 6 calls for service involving what's called a code enforcement or public health violation. Both of those are how we track them. Since September 1st, we've had 26 total. And I think it's important to recognize that, that we are partners in this with public health. Part of what we discussed yesterday was the importance in the education component. Part of the education component is social media and messaging and getting the information out to the public, that we've committed to amplifying all the public health social media messages to ensure that all the information gets out there, and that we will go and break up those groups and gatherings of 20 people that we see in a park. But going house to house and searching for these violations is just not feasible.
Any questions? Thank you. Kara, do we have any other?
No, and again, I know it's been reiterated, but just to say thank you to everyone that has spoken and shared their thoughts. It's been a really valuable listening session, I think, for a lot of people this week. So I just want to thank everyone, and I'll hand it back to you, Marky.
Thank you. Karen, let's talk about, we are supposed to have public comment. The hour is getting late and we do need to take some actions here. I'm hearing, I know there were 2 letters that people wanted to have read. One came from Dr. Brooke Allen, who the essence of her email is more about shutting down the restaurants so we can get the kids taken care of, prioritizing children. So one of her paragraphs, as you consider further precautions and restrictions, please think of our young children who need to be in school. Please place specific priority on keeping elementary age students safe by reducing spread in our community, as our current level of community spread is negatively impacting these young people. You can keep restaurants open or you can keep schools open, but likely not both, given the level of community spread we are seeing. I urge you to place your priorities on education of our very youngest. So that is the essence of Brooke Allen's. I don't have Gail Misner's note. Greg, you may have it.
I have it, and it's a little lengthy, but I think the gist is identical to Brooke Allen's. It's a long letter, but I think she covered the same points regarding the importance of keeping the kids in the schools for the mental health as well as the health of the entire family, not just the kids. But there was more to it about the importance of nipping this in the bud now rather than waiting for the bigger tourist season to arrive also.
Okay, then there was another earlier question. How many more days? We're in day 6 of being in the red zone. So that's what, Karen, 8 days, or Jordana, that we've got to get this turned around?
That we're in that, sorry, that our numbers are in the red zone. Yeah, well, you all heard what Mara said, so I'll just let you interpret that.
So, there's something that I found absolutely amazing today. And that is our business leaders took the challenge that we gave them on Monday. And I cannot believe the quality of the work that came from our business community that has been presented today. I don't know how I can thank you enough. And on behalf of the board, I really honor every one of the recommendations. And with that, I'd like to know if our board would be supportive of looking at Orange Plus. Brent, I'm sorry, I see your hand up.
All right, I just wanted to say that relative to what I guess was Dr. Allen or Brooks Allen, I'm not quite sure. But to this point of schools in Europe open, they feel that they are absolutely necessary component to their society and an economic generator. And they made the same argument that we've heard earlier today relative to the comparison. of restaurants and so forth being open. And I must say, it upsets me, but it was said earlier that we're on this track to where we are in the red and we're getting worse. And it seems like most entities have not been able to turn this thing around. The virus does what the virus is going to do. And there's positivity rates. One state, I believe, is 90%. There's several of them at 50%. And it just seems to me, my opinion, is that if we're going to believe the science, right, and we do, and if the mathematics tells us, the physics of this thing tells us that we're going to be in the red in a few days or a few weeks, then it seems to me that we need to really consider whether we need to do this ahead of time so that we can emerge out of this, if we're going to, earlier. Otherwise, we're following it again. We're reacting just a little after the fact. So I just wanted to throw that in. Thanks.
Other people on the board, Tom?
I commend each segment of the business community that has creatively come forth and researched this topic. And in 2 weeks from now, which will be our, as I recall, our meeting right after Thanksgiving, we will have the opportunity to see what has developed, and hopefully we'll have shown at that point that in these 2 weeks, some difference has been made, and we won't have to go into the 30 days leading into the Christmas period. So I urge everyone to think creatively in each segment, and let's look at the exposure sources that Joshua Vance has in his pie as he shows it. Hopefully, whatever segment of that industry segment of the pie will have been reduced in 2 weeks from now, and we can go forward with fewer cases.
And if restaurants could test, and this is not far beyond the pale here, if a restaurant or a venue could test people as they come in and 10 minutes later have a reading, right? Then the people inside that venue would be safer than they were 15 minutes before outside that venue. So maybe there's some, and of course, maybe they'd have to apply to this. Theoretically, if that could be done, that would be one solution.
Thank you, Brett. Patty, I'll take your comment.
Yeah, I'll be really quick because I know time is, it's been a long week, I think, for many of us. I support the orange plus. I'm calling it bright orange, which means as in bright meaning smart. It's a smart orange move. I agree with what Tom Kurt said. I have a real positive feeling. I think these actions, especially the ramping up by these other service industries, I think it's going to make the sectors is going to make a big difference. We're going to see some positive results. I think messaging is really critical. We need to let this community know that the survivability of this community is in their hands. The community's responsible now, and we need them to take this seriously and help us work to these positive outcomes, because without them buying into this, we will fail, and they need to take responsibility for their actions and help us move forward in the positive direction. And I'll write a message if you want me to.
We really do need to do that. Patty, I totally agree. There was another public comment that came in earlier today about mask and mask ordinances, about someone lives in a mask zone. She counted the number of people that walked by her house today without a mask on. So I think we've got to really enforce that message as well. So other members of the board, do we have Greg?
I just want to repeat an email I had earlier. The gist of it was, and this is something Dr. Misner said as well, is the effect is if you could improve our chances of having a winter tourism season economy by shutting down now for 3 to 4 weeks, would you do it? That was a question. And I think it'd be nice to know if we really do clamp down. Maybe it's not red, maybe it's orange plus, but we really take this extremely seriously. are we going to dramatically improve our chances of being able to reopen? And of course, we don't know the answer to that, but what chances are we taking if we don't? That was a question that came in, and it was also the gist of from Dr. Misner, who is advocating, let's clamp down now. This used to be called off season. And I know some people are in business year round now, but there was a time when people shut down this time of year and did close down and went away. So maybe this is the absolute best time if we're going to clamp down. We're lucky enough that this is our chance to do it. Thanks.
Are you advocating for a lockdown, Greg?
You know, I don't think, personally, I'm not convinced a lockdown is going to work. I think, once again, it comes down, as people have said earlier, it's a personal responsibility issue. But if we all, we're all going to have to commit to it one way or another. So no, I'm not going to advocate right now for a lockdown. I'm not sure what the rest of my board, how they feel about it yet. So I'm not going to say that just yet.
A lockdown is only going to be effective if we can deal with the incoming population, which doubles each week in Aspen. A lockdown is effective if you have a very stable population without tourists. We're dealing with, doubling our population. So we have to deal with the incoming travelers in that suggestion that has been made earlier today.
Okay. Thank you very much, Tom. That is very insightful. For me, as former mayor here and chair of the board here, I do not support closing all the businesses at this point in time. I'm a believer in our community, our business community. They've worked hard with their plan. Now we have to work the plan. So my thinking is we support our businesses accordingly. And Tori, I haven't heard from you.
Hi, Marky, thanks.
Hey.
Yeah, on behalf of the city council, I want to represent that we support an Orange Plus. We do feel like there are additional measures that have come forward that we'd like to incorporate in that. So yes, we are supportive of Orange Plus for today's decisions. Marky, I also wanted to, I guess after we talk about this, we might come back to the letter to the state as well as the visitor pledge.
Mm-hmm. Okay, if I have if I've got consensus, it appears, from board members going to the Orange Plus. Karen or Jordana or John, have you heard differently?
I haven't heard differently. I think we just want to go ahead and define when we say Orange Plus is that we're looking at all the mitigation strategies that the sectors have put forth and that there's an expectation that those are all being met. Okay, just want to clarify that.
Yeah, and thank you for the slides, Kara, for putting those all together. We really appreciate that. And Jordana, that's what you've heard too?
That's what I've heard too. And then just clarifying, if the board is in support of having us pass a public health order to solidify those Orange Plus measures, and then when we would want to aim for making those go into effect.
And for how long?
How hard is it?
We review this in 2 weeks when we meet again.
Well, we may be in red by then, so the public health order needs to get done. How long does it take you to put the public health order in place? We're already, according to the state, we're already in orange.
Marky, I think it may be helpful for the board to, we are under requirements from the state to be at the orange level of restrictions. And so that's the baseline, that's now. And so I think what I'm hearing from the board is that each of the industry sectors has made recommendations for additional mitigations that we would need to codify into that plan. My suggestion, and I'm looking at Karen's tile here to see if she's going to kick me, but the orange we need to go into right away. It may be that we need a day or two to get the documentation together for the Orange Plus. And so I would recommend a staged process there.
I totally agree with you because both Jordana and Karen have worked, I don't know how many hours in all last weekend. So let's get a couple days there. Karen, you can let us know when they would be done. We'll leave that between you and Jordana. Okay, we've got
Hey,
some.
Marky, Greg
Yep.
here. Just wanted to say I just took a quick survey of my board, and I think we're all saying Orange Plus with the conditions as have been laid out and the recommendations laid out. So I think we're going to go ahead with that.
That's great. We need to continue to work on some messaging. That's been loud and clear today. Rose, I'm sure that you and your staff and ACRIC will put their heads together on messaging. Okay, appreciate that. Now let's move back into the notion of the letter. Do we have support from the board or a motion from the board to send that letter to the state?
I so move.
Do I have a second? Yep, I've got Linda. So we have a motion, we have a second. All in support, just raise your hand. Okay, that passes unanimously. And Kim, I really want to thank you for putting the draft together. Excellent work. Now, let's talk about the affidavit. I don't remember who brought that up. I think it was Mike Kaplan, or was it you, John?
I think I think I did. And I think it was the in relation to an option that we might be able to implement more quickly if this board wants to pursue travel restrictions independent of the state. The QR code process, I think what you heard was that's going to be fairly resource intensive and take some time. And frankly, Thanksgiving's next weekend, and we've got a few weeks before the Christmas holiday, and there's got to be communication to there's a whole lot that's got to happen if we're going to do this on our own. What I had recommended was a simplified process, and it's not unlike what Massachusetts and I believe New York is doing, which is instead of uploading test results and having the QR codes and such, what Massachusetts does is they have an app talking to our IT folks. We think we can set that up relatively quickly, where travelers would upload an affidavit that they've had a test. The public health order would have a requirement that anyone visiting Pickens County would be able to produce evidence of a negative test within 72 hours of their travel time upon request by public health. And then basically what we'd be asking of our partners, and this may require some input from the industry folks again, is help with screening. We talked a lot about the airport, but that is a small percentage overall. It would be providing the kind of information at some touch point, whether it's in marketing or such, to say, hey, you have to have this affidavit done. Have you done it? Here's where it is. And for those who haven't, I would suggest some kind of testing requirement within a certain period of time. The fact is, as we do this as a county, a lot of people aren't going to know about that requirement. It's going to be a marketing challenge. We're going to have a lot of people come here without that test. We'll catch a number of people too with the process, which is why here this board's goal is. But if we're going to try and catch everyone through checkpoints and matching QR codes and having them match to uploaded test results, I'll tell you right now, we'll be doing it probably in February by the time we get that put together. It took states months to put those things together.
So, John, do you have a copy of that wonderful affidavit from Massachusetts?
I have, yeah, hold on. Let's see if I can.
Can we copy and paste?
So I've certainly had it out to our IT folks. It's not really magic. You put in where you're coming from, your name, contact information, home address, where you're headed. Then the affidavit part starts with a test and quarantine status. The other piece that I think is important is the symptoms, and then dependent information, and then your attestation. And then, if they're from an enforcement perspective, I don't know how to get out of this.
There you are.
Yeah, from an enforcement perspective, then, you can stand up this kind of attestation. We have a platform that we think could accept, I believe, up to 1 million of these that would come in. And then we can build on the back end if we wanted to do some spot checking, those sorts of things.
How long
But
would it take you to put a program together like that?
well, I have no idea how to do it, so it'd take me forever. But we actually, our new IT director is out on a family emergency. We were going to meet on Monday, but it sounded like they're more confident about being able to stand that up quickly, certainly prior to our big holiday traffic. I think there's a little bit more concern about working through all the complexities of the QR code matching and uploading healthcare data and protecting that information, so on and so forth.
Okay, any thoughts or comments? Yeah, Jimmy?
I have one question. How is this not falling on the one common denominator for all visitors? Hotels, lodging. How is lodging not stepping forward and making this a requirement of every single reservation that they take, that this type of affidavit is complied with? It seems like whether you're driving or flying or busing or whatever, you're going to stay somewhere. Now, it may not be 100%, but if we got all of the registered lodges and hotels, short-term rentals, to climb on board with this, it could probably happen next week. You take a reservation, you don't get a reservation unless you fill out this affidavit and then make it happen. Your reservation gets canceled if it doesn't happen. You just got to go for it. I mean, we can't sit around and let bureaucracy be a failure. So lodging, I'm looking to you.
We would support it. We'd be happy to link to whatever that app is and help foster that process.
Tori, do you have your hand up?
Yeah, I want to make sure that I'm keeping everything in the right places here, because John was just talking a lot about the test requirement for a visitor. And the visitor pledge or the disclaimer, whatever we want to call it, it had a couple of components that people were looking for. Signing off on knowledge of local guidelines and compliance, a willingness to comply. The assumption of responsibility for any isolating quarantine costs that would be incurred if you're doing that. A waiver saying that you are not symptomatic and you have not been in contact with anybody that has tested positive recently. So what we heard from Donnie and Jeff was that, some lodges are already doing that kind of mailer out. My suggestion here is that we need a unified singular one that can be utilized by everybody, because there's lodging managers or property managers out there that aren't, with Donnie and Jeff, and I've spoken to a few of them, and they want to get a form that they can utilize. So my suggestion here is that our public health organizes that affidavit. I don't know whether the 72-hour requirement fits into that right now or not, but I know that the thing that we've been talking about, there is a desire for one to be created by public health that everybody can share, and it's a uniform and similar document.
Tori, I suggest it's made mandatory. I don't think this is an optional idea. I think that I know that Skiko and Donnie and the other responsible hoteliers in town, and sure, to Debbie's point, there are plenty of people that might stay in second homes and other places, but this could be rolled out very quickly and uniformly, like you suggest.
Yeah.
But I don't think, I think it's part of an order. I don't think this is optional.
Which part, Jimmy? The letter itself or the 72-hour?
All reservations have to contain some sort of affidavit by the guest agreeing to the conditions that we put forth in order to come visit Pickens County. Period.
Correct.
Story. Full stop.
Correct. Yes.
So
I think this is something that we can do now. The platform that we have, I had the numbers wrong, I apologize, would allow for 100,000 submissions per month. I think that should still cover us on the guest load.
Okay.
Just looking for, does that cover us in February and March? Yeah. Okay.
Yes.
And I think what we would do is set it up with QR codes so that if in fact guests do, because we're going to have it happen. Guests are going to come here and they will not have filled this out, but we're going to need to get them to do so while they're here, but we can provide lodging with QR codes and logins to make it as easy as possible. I will need to work with my IT staff. This will not fall on public health because public health does not have the staff or expertise to do this. So this will fall back to the county. So I will need to just get a thumbs up from my board, but I think in general, they're supportive of this concept.
Anne?
Yeah, Marky, and then John, how would we get it to the second homeowners? Will that be covered by sending it to property managers? My biggest concern is general aviation. People just, all sorts of restrictions and information at the airport, but nothing out there. So how do we?
That's not accurate, Ann. First of all, we do have information out at the terminal and such.
Oh, I apologize.
Yeah. I know that's been out there. It's not necessarily the case, but there are circumstances where I think it's hard to catch because not everyone goes through the GA terminal and such.
But in terms of the second homeowners and people that aren't in the lodges, I have great faith that the lodges will present this to all their guests, but how do we get it to other visitors?
Well, and it's also going to be, the airport isn't our big catch. It's going to be, like you said, the lodges, the property managers. It is going to be the same challenge that we've had. And how do we capture people quickly as they come into the community? And so, we may ask even the restaurants and such to make sure that, maybe you can put an 8x11 up there, say, have you filled out your affidavit and pledge with a QR code? As people are coming in or picking up food, this has to be a yes and strategy. And just like lodging needs to be involved, we need all the other touch points involved. But I think it can be pretty simple. I think the simpler we make this to accomplish our goal, the more likely it is to be successful.
Well, I think we'll let the IT staff work through all the logistics of this. And Kara, I don't know if you're going to loop back in with the lodging industry or how we're going to get everybody on the same page, but I do think it's the right thing to do. And we're just going to have a thumbs up from board members if they're supportive of moving forward with John's suggestion.
Marky, real quick, Tori did ask if this was going to be part of the next public health order. Are we going to include this affidavit language, not in the one that we're required to do tonight by 5 o'clock, which was a while ago, but the one that'll be coming forward, the Orange Plus, I should say, public health order. Is this going to be included in that?
I would say yes. As long as we get support here from the board, and it looks like we do have support. So with that,
Marky,
yeah.
Before you switch, just I'm fielding texts and emails here, and one of them is regarding the outreach. It shouldn't just be left to the county's IT. I'm expecting that ACRA, the individual hotels, restaurants, anybody who has a client list is going to be doing this outreach. We're all on this team now. If it's the county IT, it's going to miss a lot of people.
Well, they're going to put the logistics together, and I'm looking for Rose and Deb.
And Greg, just to be clear, I don't see county IT doing the outreach. I see us providing an application.
Right.
Just to be clear.
Excellent. Thanks for clarifying.
And that's why we just hired a new IT director this last week. So we want to break her in right.
Okay.
Marky, can I just get clarification? Because if we're going to be tucking this into the public health order, I need to understand what we're actually writing. So are we saying that all businesses are required to have this affidavit option? Like, I need to know what the language is.
I think John's got it. I think John Peacock has the language, Karen.
I think Karen's question is good, because I was about to ask, I think, the same question, because as I'm understanding it right now, we're targeting the requirement to individuals to fill out this affidavit, and that affidavit would include several things. So Tori, I think you had listed, a commitment to our 5 commitments to containment and the 3 C's, the 3 things to avoid. Our mask requirements. And then I think the question mark is the testing piece. Are we asking for a negative test 72 hours before people get here, and they would certify that they've done that, and they understand that upon request, they will need to show evidence of that?
Yes.
That's what I'm understanding. That's targeted at the individuals.
Right.
What we're asking for is partnership from our lodging community, our restaurant, all these different touch points on that marketing side to make sure your customers, your clients understand that this is something that needs to be done while you're in Pickens County, because we're going to miss some folks before they come here.
Right.
We also need to include the language about quarantining and who's responsible for those costs.
Yeah.
Marky?
Yes, Kim?
Yeah, I just wanted to make the comment, John, if we could also please include either in the affidavit that you upload evidence of your test, or you state in it that you will be required to show it on arrival.
Yeah. What I am suggesting is that it's shown upon request. So if we're set up to screen a bunch of people, on Highway 82 and such, we have the ability to do that. But if we've got to build a system that can protect health care information and upload 100,000 tests or whatever it's going to be a month, we're not going to get that done quickly. I can't guarantee that.
My recommendation was to, on arrival to the lodge, that as you check in, you would be required to show evidence of your test. Just some kind of a backup where they're not just checking a box and saying, yeah, I did it, and then taking the chance that they do or don't get screened for it. And then I also offered symptom screening on it, and then a 10-day isolation, a 10-day symptom-free and no exposure statement as well.
And John, job form does have HIPAA compliance, so I think we just need to work through what that looks like.
Yeah, Josh, I've been talking with Carrie though, and so if we want to do this for the holidays, I'm just telling you what I think we can deliver.
And because it's not a state requirement, are we specifying out of state visitors, or anyone from out of the valley is required to complete this?
So if somebody comes up here for dinner, they have to complete this, and they're from Carbondale?
I think Josh's original request was that if you're staying for at least one night, so you have to be staying overnight, or we can make it more than one night, but at least you have to be staying here, not just day visitors.
I think we've got a lot of detailed questions that we need to work through, that I don't think that we can sit here and all night figure this out. I would ask the staff to come up with recommendations on how to implement implement what we want to, what are we really driving at? My thinking is people coming up from Denver should be required to do this. People from Carbondale, it makes absolutely no sense. So,
Can I make a question real quick? I think we need to keep this first blush attempt simple so we can get it out there for the holidays.
Yes.
I think it'll start to evolve once we get more technology and more information about scanning test results, and that's the next phase. But we need to do something now, especially since we're going to start this, hopefully this Orange Plus. We need to have this as part of that, and let's just try and keep it simple so staff can get it done and we can actually start doing it.
Okay, I've just got a note here. There is a community meeting. It starts at 6. We need to let people get refreshed to go on to the community meeting here shortly. So Patty, I appreciate that comment. Keep it simple, and then we'll build on additional pieces. Okay.
I think this is going to give the visitor confidence. There is a chore of requiring it, but think of the mothers that will be confident that everyone in the hotel has been tested.
Right. Good point. Excellent point. And with that, I'm going to call for adjournment. Do I have a motion to adjourn?
So moved.
Seconded.
Do I have a second? Thank you, Greg. All in support? Raise your right hand. Thank you all. And I want to thank everyone who's participated in this meeting. We had over 280. I see 198, and everybody's starting to sign off. So thank you very much. A great meeting.